So welcome everyone to meeting number 30 of the House of Commons Standing Committee on Health. Pursuant to the order of reference of May 26, 2020, the committee is resuming its briefing on the Canadian response to the outbreak of the coronavirus. To ensure an orderly meeting, I would like to outline a few rules to follow. Interpretation in this video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen of either floor, English, or French. As you are speaking, if you plan to alternate from one language to the other, you will also need to switch the interpretation channel so that it aligns with the language you're speaking. You may want to allow for a short pause when switching languages. Before speaking, please wait until you are recognized by name, and during questioning, the questioner will signal to whom the question is addressed. When you are ready to speak, you can click on the microphone icon to activate your mic. A reminder that all comments by members and witnesses should be addressed to the chair. When you are not speaking, your mic should be on mute. I would now like to welcome our first panel of witnesses. As an individual, we have Professor Lawrence Gustin, O'Neill Professor of Global Health Law, Georgetown University, and Director, WHO Collaborating Center on National and Global Health Law. And from the Center for Global Development, we have Jeremy Konyn-Dyke, Senior Policy Fellow. That's Konyn-Dyke. I apologize. And witnesses will have up to 10 minutes for an opening statement. We will start with Dr. Gustin. Please go ahead, 10 minutes. Mr. Gustin?
Just a basic, thank you for reminding me to unmute myself. Mr. Chair, thank you. I'm very much honored to be with you. My charge today is to discuss the international dimensions and the governance dimensions, particularly the role of the World Health Organization and the performance of the international health regulations. I've worked with the World Health Organization now for over 30 years. I'm also on the Director General's roster of experts committee on the international health regulations. I've been closely involved in many epidemics and pandemics, ranging from AIDS to SARS, MERS, Ebola, and of course now the COVID-19 pandemic. And so I'm going to give you the benefit of my many years of experience. I consider myself a very close friend of the World Health Organization, but I'm also willing to be a friend and to state honestly when I think it could have done better or should do better. And so what you'll get from me is a non-political, factual account of how I think the World Health Organization has performed and how it can be better. I ask the members to take that not as a political statement, and that because there's been so much politicization of the World Health Organization, particularly from my country in the United States, but also China. So essentially, there are several criticisms of the World Health Organization during this pandemic. One is that it didn't report quickly enough concerning the outbreak of a novel coronavirus infection in Wuhan, in Hubei province in China. Secondly, that it did not inform quickly enough that there was rapid community spread in that province. And then finally, that early on in the pandemic, it recommended against travel and trade restrictions. Early on in the pandemic, China was reporting to the World Health Organization that there was very limited or no human-to-human transmission of this novel coronavirus. At that time, the World Health Organization reported those same data and conclusions that it had received from China. In retrospect, should WHO have done anything differently? Well, at most, they could have said, here are the data I'm getting from China, but I'm not able to independently verify it. Dr. Tedros, the Director General, made the decision, and I respect it and do admire it, to push China quietly, diplomatically from the inside, but not to criticize China publicly. But it should be very clear that under international law and the Constitution of the World Health Organizations and World Health Organization and international health regulations, the WHO had no power to require China to report truthfully. They had no power to go on to Chinese soil without China's permission. And therefore, it's entirely unfair, I think, to criticize the World Health Organization for doing something that the world did not give it the power to do. Going forward, I have a number of proposals, and many of my colleagues do, including those in public health law and global health law in Canada, that could improve that situation remarkably and give WHO the power and authority it needs the next time this horrific or kind of horrific event occurs. The same is true with community spread. There was no way for the WHO to independently verify China's report regarding that. Then there was the question of travel. It certainly has turned out, for better or worse, and we can discuss that the world has closed essentially its borders due to COVID-19. But early on, WHO recommended against travel restrictions, even though many countries had already done it. They did so because after the SARS epidemic, and of course, Canada was instrumental in the reform of the international health regulations, there was a balance between public health, trade and travel, and human rights. And Canada was justly concerned that countries were too quick to have trade and travel restrictions during SARS. The same thing happened during West African Ebola epidemic. Many epidemics have triggered harmful and unnecessary travel and trade restrictions. In this case, it may very well be that travel restrictions were warranted. But at the time, WHO was following the international health regulations in the way they were meant to be followed. And so I may have done some things differently, but I cannot believe that it's right in the middle of a pandemic to have casting of blame, finger pointing between countries that harm the international rule of law and that harm international institutions that are so vital to us, like the World Health Organization. WHO is not perfect, but we as a collective community can make it better. And why I'm so pleased to be here in front of the Standing Committee on Health in the House of Commons is because I so admire Canadian leadership around the world. You have been the shining light. I have a close connection and heart to you. My son was born at McMaster University and is a citizen of Canada, and I have very close connections with my colleagues in Canada. And so trying to forge unity in the world in the midst of this chaos, in the midst of conspiracy theories about the origins of the virus and all of the blaming among the superpowers, we need to come together. And we need to come together now, even more than ever, because we're facing the most consequential set of actions in our lifetime, which is the race to find a COVID vaccine. We need, as a global community, to ensure that that vaccine is safe, so we don't cut corners, we don't skip ethics. And we also need to ensure that it's equitably distributed fairly to all countries around the world, and that we do not see what we've seen for personal protective equipment, testing kits, and ventilators, which is a price or intellectual property competition. I regard vaccines and therapeutics for COVID-19 as a global public good, and I look to Canada for your global leadership. And I find it a great honor to be in front of you, and I'll be very delighted to answer any of your questions.
Thank you, Dr. Gossan. We go now to Dr. Konyndyk. Please go ahead, 10 minutes.
Thank you so much. And just echoing what Larry said, it's a real pleasure and a privilege to be speaking with you all today. I also have ties to Canada. My mother grew up in Hamilton, and I still have a lot of family there in Ontario. So it's really nice to be speaking to all of you. So just a quick few words on my background and how I come at these issues. So I come from a disaster response and humanitarian background, have worked on many health crises over the years, and most significantly, I was the head of international disaster response for the U.S. government during the Ebola outbreak in 2014 and 15. And so I played a key role in leading the U.S. government's response to that. As part of that, became involved with WHO emergency reform, and so advised the then Director General Margaret Chan on the post-Ebola reforms that were implemented, and have served for the last 4 years on the independent oversight body, along with Dr. Theresa Tam of Canada, that is overseeing and advising member states on the WHO's implementation of those reforms. So I've had a sort of front row seat both for the Ebola, the kind of WHO's Ebola failures and shortcomings in 2014, and also their handling of this outbreak and this pandemic and many of their other crises in between.
Mr. Konyndyk, excuse me, could you hold the mic? Thank you.
Okay, I'll hold it even closer. I hope you're able to mostly hear that. Now, but to be clear, I'm speaking today in a personal capacity. I'm not speaking on behalf of the Oversight Committee or on behalf of WHO, unless I otherwise say very explicitly. So I've been asked to speak to a few things, some of the emerging lessons from COVID-19 around the world, and particularly in the developing world, WHO's effectiveness, and the support that is needed to the developing world going forward. So I'd like to take first just a few observations of what I think we're seeing from around the world. We're seeing, I think, in many countries now, social distancing measures have worked, but they are hard to sustain. And particularly the more drastic social distancing measures are very difficult to sustain economically, politically, or socially. And so we're moving from a phase, I think, in which governments were largely imposing distancing measures to a phase in which we need communities and populations to voluntarily adopt distancing measures, whether governments are imposing those or not. What we do see is that anywhere that people have let their guard down, the virus takes advantage of that. And we're seeing that in real time right now in the United States. Some of the states that had not been badly affected early on dodged a bullet and concluded they were bulletproof. and began relaxing measures. And now we're seeing enormous spikes in Florida, Texas, Arizona, and some of the other southern states. We're also seeing in some of the areas of California where they relaxed measures too early. But I don't think we're at a point where we can go back to governments just imposing measures from the top down. So they need to be adopted and owned by the population, and that becomes then a matter not of governments imposing measures, but of governments communicating effectively with their people, and public health authorities communicating effectively with their people. And I think in the countries that have done the best job of clear communication and building trust with their populations, with their publics, those are the countries that have done the best and it will do the best. And the countries that have seen the most confusion, the most mistrust, are the countries that will do the worst. And if the worst performing countries in the world right now are the United States and Brazil. And in both of those countries, there has been horrible communication between the government and the public, and a lot of confusion and a lot of mistrust. The countries that have done the best job of communicating clearly, and I think Canada, from my observations, has done a better job of this, will do better and have done better. Having closely observed the calamitous performance from WHO in the early phases of the 2014 Ebola response in West Africa, there's just a night and day difference to what they're doing now. At that time, they did not have a robust emergency capacity. Their leadership did not take the threat seriously from the beginning. Their country offices were disengaged and inattentive. There were just problems at every level of the organization. I think what we've seen here is a very, very different thing. From the beginning, that the organization was fully engaged. Within days of getting the formal confirmation from China of the outbreak, they were putting out technical guidance to all member states. At that time based largely on diseases like SARS and influenza, so kind of parallel diseases that we had seen before, because there was not much data to go on about the virus itself in those early days. That is not uncommon with a novel virus. There is always an inherent amount of uncertainty in the early phase of the emergence of a novel virus. And so, as Larry laid out already, there were some real challenges with China's initial reporting. I think WHO's handling of that, was problematic, not in terms of WHO's performance, but problematic in terms of what WHO is actually authorized to do. So the international health regulations tie WHO's hands very, very tightly in terms of what they can say above and beyond what member states report to them. And I think WHO's reporting in those early phases was, if you read between the lines a bit, they were definitely hedging, because they knew that what they were getting from China, may not be the full picture. And as that picture fleshed out, so within about 3 weeks of the confirmation from China, WHO's country office in China was authorized to do a mission to Wuhan and do an on-the-ground investigation. And immediately after that, which was done the 20th and 21st of January, immediately after that, WHO came out and confirmed human-to-human transmission. Within another day or two, they convened the emergency committee to review whether to declare it a public health emergency of international concern. At that time, WHO confirmed a basic picture of the virus that still holds up pretty well today, which is that it was a novel respiratory coronavirus, that it was transmitting efficiently from human to human, that it had a reproduction number, i.e. a transmissibility factor that was seemed higher than seasonal flu, and had a severity and a death rate that was absolutely multiples higher than seasonal flu. All of that picture right there, it's as an initial picture of the virus, it's an extraordinarily scary picture. And within another week after that meeting, WHO took the step of declaring a public health emergency of international concern, which is the highest level of alert that member states have created for WHO under the international health regulations. So at that point, WHO had rung the loudest alarm bell that it has available to it, and had provided a picture of the virus that holds up pretty well today and should have been very alarming. And I think what we see is a huge amount of variance in how states reacted to that. So some countries, particularly the East Asian countries that had prior experience with SARS, took it extraordinarily seriously, began immediately implementing very drastic measures. South Korea, Taiwan, Hong Kong, Japan, Thailand, Vietnam, they all clamped down very quickly, began scaling up their testing, began implementing distancing measures, and so on. Western Europe, most of the Americas did not. And so you had different countries looking at the same information from WHO and doing very different things. And I think that is reflective in part of those countries more than it's necessarily reflective of WHO. I think it also does reflect, and this is something that in a report that the committee I serve on published last month, we highlighted a few takeaways from that, emerging takeaways from that whole period. One is that I think it's important to distinguish where were the failings and where were the weaknesses. So what were the things that WHO as the sort of secretariat and institution did poorly, and there are some, but I think broadly they handled it well. What are the failings that were failings due to countries' reactions to the information WHO was providing? I think there were many countries that were far too cavalier in assuming that this would be a problem that would be in China but would not affect them. And what are the problems that rest within the international health regulations? So what are the problems where ideally, sorry, my kids are going a little crazy upstairs. What are the problems that are, problems where WHO's ability to do more or to be louder or more forthright is limited or inhibited by the restrictions member states have created within the international health regulations. And I can go into more detail on that. I again agree with some of Larry's points on this earlier. I think we also, in the committee report, found that the public health emergency of international concern, this alarm bell that WHO can ring, is far too blunt a tool. It is a binary on or off. It does not have any gradations within it. And so, it is declared for something like this, which is a world-threatening pandemic that will kill, will kill potentially millions of people. It's also declared for something like the Ebola outbreak in Eastern Congo for the past 2 years that has killed a few thousand people, and not really gone beyond that sub-region of Africa. So there's a huge range of health crises that are included in that kind of a tool, and I think we need more gradation so that countries can read those signals a little bit more clearly about what the level of threat is to them when a declaration of that emergency is made. We also found that the post-Ebola reforms have been effective, but were also premised on a different sort of crisis. So they were premised on things like the Ebola crisis in 2014 and the sort of normal range of humanitarian emergencies that WHO normally contends with, and that something on this scale has hugely strained the bandwidth and the capacity of WHO, and that WHO has not always done as good a job of managing some of the capacity trade-offs there as we'd have liked to see, particularly when it comes to keeping an updated kind of set of technical guidance and recommendations to countries. And I think that's the last point that I want to make, and to pivot to the question on lower and middle income countries. I think that both WHO and also institutions like the CDC in the US have been very slow or too slow to adapt the strategy and the guidance that has been developed largely for rich countries to lower income settings. So, I think one of the interesting characteristics of how this outbreak has played out is that it predominantly affected wealthy countries at first. China is a wealthy country with a very developed health system, and then it hit Italy and it hit Spain and it hit the United States. All of these are countries that have a high capacity for clinical treatment, that have a lot of resources to scale up testing, have a lot of resources to sustain large-scale social distancing and lockdown measures. That few of those things are true in the developing world, and so there, it took the WHO along with the rest of the UN system did put out, I think, very good guidance on this in, I believe it came out in mid-May, but it should have come out earlier, and I think that's partly a capacity issue within WHO. But that left a lot of lower income countries struggling to figure out what is the strategy they should apply, because scaling up ventilators, scaling up massive testing, scaling up PPE production, these were not things that were really available to them financially, and the ability to sustain a lockdown when you have a large informal economy, a large gray economy, is also very difficult. One other point I would make on lower and middle income countries, there is very little money that is getting to frontline local organizations in those countries. I published a piece this week that looked at the aid flows that have gone to humanitarian aid flows that have gone for COVID. It's about $2.5 billion now that's been contributed against the global humanitarian COVID appeals. Of that, about less than $2 million out of $2.5 billion is reported as having gone directly to local frontline organizations. And I think that's a recipe for failure because, as I said earlier, we're at a point now where we need to transition this response from something that is government imposed to something that is community owned and led. And if more than 99% of the money is going to international organizations and international partners, and the local community and local groups are getting only the scraps of the scraps of the scraps, it's going to be hard to succeed. I'll stop there. I look forward to your questions. Thank you.
Thank you, Mr. Kanandijk. We'll go now to our questions. We will do 2 rounds of questions. We will start the first round with Ms. Jansen. Ms. Jansen, please go ahead, 6 minutes.
Yes, thank you so much. I would like to actually begin my questions with Professor Gostin. I wanted to just ask, based on WHO recommendations, Canada did not implement a travel ban early in the pandemic. Now, in an article you published in The Lancet on February 13th, you claimed that Canada was legally bound to follow that recommendation, when in actual fact, that's not the case. So how much pressure did the WHO put on Canada to follow this non-binding agreement to the detriment of Canadians' public health?
Thank you for that question. The international health regulations are a binding treaty, and Canada is one of the signatories for it. But you're absolutely right that when WHO makes recommendations, once it declares a public health emergency of international concern, it can make recommendations. Those recommendations are recommendations, but they have strong normative force. And so we would expect countries to take it very seriously, but you're probably right. Being bound by it in a formal legal way there is probably not true, since they are specifically in the IHR stated as recommendations. I'm
just curious. Have you heard of a single member state filing an Article 56 dispute against another member state for instating travel restrictions due to COVID-19?
No, because we don't really have a lot of enforcement or compliance with WHO recommendations.
So that is a bit my concern is that if WHO and people working with them, give the impression that it's we are legally bound, and so therefore we follow those recommendations, it actually did hurt Canadians' health. If you look at South Korea and Taiwan, both fared far better than Canada. They imposed travel restrictions on February 4th and 7th, which was, of course, contrary to what WHO was recommending, whereas Canada waited till March 16th. Now, if you look at South Korea, they had 5.4 deaths per million. Taiwan had a total of only 7 deaths, whereas Canada has had 228 deaths per million by comparison. And that's an abysmal statistic, wouldn't you say, for a first world country?
It's not ideal, but I would not blame the World Health Organization for the death rate in Canada. Absolutely not. I know WHO well. WHO is very, very unlikely to have put enormous pressure on Canada. And remember, Canada was one of the major movers under the international health regulations to actually balance trade and travel with public health. The country of Canada was rightly quite concerned after SARS and during SARS that there was so much travel restrictions placed. Normally, travel.
But the thing was that the travel restrictions would have actually saved Canadian lives, and I think you can see that from the impact of South Korea, Taiwan, a lot of those other nations closing their borders.
No, I don't agree with that. I think that the reason why I worked very, very closely with Taiwan, South Korea, and others on their response. They did well. Not,
I know if I look at Sam Ellis, he's the Taipei bureau chief for Bloomberg News. He believes that Taiwan's isolation from WHO helped their country by forcing it to rely on its own judgment on health issues. They were turning away cruise ships, doing health checks at airports, even though WHO was assuring them risks were low. Would you agree that South Korea and Taiwan were far more successful at containing the virus than those countries who followed WHO advice?
Oh, no, they were following WHO advice, very much so. You're focusing on travel. Why Taiwan and South Korea, which is a WHO member state?
Also masks, right? There were many things that we were told by WHO wouldn't work. I know Dr. Tam was telling us, don't wear masks. They don't help.
Ms. Jansen, could you let the witness answer, please?
Yeah. The major way that South Korea, Taiwan, and other countries dealt with this is very early on using widespread testing, very aggressive contact tracing, and including using electronic applications on their smartphones, isolation and quarantine. I've worked extraordinarily closely with South Korea and also Taiwan on this, and that was the operative thing. It was not travel.
So you're suggesting that it's only contact tracing and closing borders would have made no difference, is what you're suggesting, and I guess that is the question here. Is that actually correct? And I would put it to you that might be incorrect. I know Vietnam imposed travel restrictions on February 1st, and they suffered 0 deaths due to coronavirus.
No, I'm not saying that travel restrictions couldn't or wouldn't have been helpful early on. At that time, we were facing a novel virus. Most of the time, travel restrictions weren't used. I think we just don't have the evidence to make strong assertions. We do know that testing, tracing, isolation and quarantine, and universal mask wearing is very effective.
Right. So you suggest that we don't have enough science, and yet Vietnam had enough science to be able to keep their deaths at 0. Why is that when we are at 200 and whatever the number was, 228 deaths per million? We have our own.
Ms. Jansen, please let the witness answer.
Frankly, there are countries, mostly the United States, but less so Canada, that didn't take it seriously enough in the sense of really using their public health capacities. Many other countries that had experienced SARS did do very, very well, as you've said. Singapore would be another example of that. I think the tenor of your conversation is what I don't accept, is that deflecting the blame to an institution like the World Health Organization is not the answer.
So I think I have to challenge that suggestion.
Thank you, Ms. Jansen. Your time is up. We go now to Dr. Pawlowski. Dr. Pawlowski, please go ahead. 6 minutes.
Thank you. Fantastic witnesses, and glad to see you both have a connection with Hamilton, thereby affirming Bob Bertina, the MP's assertion that the world actually revolves around Hamilton. So now one would hope that the world would come together after the COVID crisis. After all, it doesn't matter where we are in the world, other than maybe some places in the South Pacific, where we're all experiencing the same things. We're all forced to socially distance, people wearing masks in public, people are staying at home, worried about the health of their elderly relatives, worried about when their income's going to start to come in. This should bring humanity together. But in fact, there's kind of suggestions that this is undermining globalism, undermining our common sense of humanity. Borders are closing. Where we're trying to make sure that supply chains are domestic rather than dependent on foreign countries. We're seeing diseases being something that's coming from other places and affecting us. Certainly, globalism has done a lot to make the world a better place. There's so many people that lived in abject poverty before globalization. There's countries like Mexico, China, India, where there was a lot of abject poverty, and now it's quite rare as a result of globalization. Similarly, the world has been a fairly harmonious place with not a lot of international conflict since the formation of the United Nations in 1945. And as I look at it, I'm a little worried post COVID-19 that we're becoming a little more fractionated, a little less together in terms of humanity. This is pulling us apart rather than together. Now, a question to the panelists: do you think this is the case? Are we going to come out of this more united as a globe or less united? And the second question is, what can we as Canada ensure the former, that we come out of this more united, more stronger, that our international institutions are stronger, not weaker, and that we're not going back to the kind of world we were prior to 1945?
Jeremy, did you want to answer that, or shall I?
I'm happy to take an initial attempt at that. I think that is a real risk. I think one of the things that has been really striking so far about this crisis, in contrast to, say, the 2014-15 Ebola outbreak, is just that lack of a sense of a common global effort. And I put some of that, frankly, on my own country. I think there's been a lot of insularity from the way the U.S. government has handled this. Usually, you look to the U.S. government to be trying to lead and convene those kind of global efforts, and we haven't seen that. I think, as that's reflective of some broader trends in the world, but it's really unfortunate. And as you said very rightly, this is we're all facing a common enemy here, and so we do need a more common approach. We're not going to be able to defeat this or be truly safe from this anywhere until it is controlled everywhere. And I think it ties back to the previous question about travel bans. One of the concerns about travel bans, all the literature on travel bans suggests that at best they buy you 2 to 4 weeks of time to prep. They do not buy you, enduring protection. And so what they will do is they will delay potentially the arrival of an outbreak in a country, but they do not prevent it unless you're New Zealand or Fiji. They're not going to prevent it. And so instead, what the utility of a travel ban, if there is such, is to slightly delay the arrival of the outbreak so that you can prepare, but it still will arrive. And I think we're at a point now where this is in every country in the world. And for a country like Canada or a country like the US or any country to be safe from it, we're not going to be able to rely on travel controls to keep us safe. We need to suppress it at home, and we need to simultaneously work on suppressing it overseas. Because as long as those, and every country is going to have a lot of dry kindling until we get a vaccine. And so as long as there are sparks flying from anywhere in the world, there's a chance that dry kindling will get hit again. And I think that's what South Korea and China have experienced as well. The greatest threat for them, since they got it back under control, has been, maybe not the greatest threat, but a significant threat, has been reintroductions from travel. And I think we're if we want to be able to get the economy back on track, we have to be able to get global travel back on track. About 10% of global GDP depends on travel, or tourism. That's a big hit. That's a really big hit if we have to sustain 2 to 3 years before there's a vaccine widely available, with huge damage to global travel. So to do that, the best way to do that is to suppress it everywhere, and that has to be a global effort. That's not something countries can just do individually.
I agree with Jeremy in everything he said in terms of the current COVID response and the need for unity. I think it's absolutely essential. But I want to, Marcus asked about the post-COVID world. And that really interests me a lot, because, one day this is going to be over. And what will the world look like, and what will Canada's role be in that world? Really important. Will it be a world that's more splintered? Will it weaken or undermine international institutions or international treaties? Will it weaken human rights? Will we see the first flare up leading to large scale lockdowns, mass quarantines, travel, trade restrictions? We've been down that road before. We really have, and it doesn't work. And so what I appeal to Canada because I've seen from your southern border, the country, frankly, that I sometimes wish we were in the United States, one that does engage globally, one that does, lead, that talks about human rights, talks about trade, travel, globalism, and the rule of law. That's what I want to see. And we have a choice as a world. We can go down one path and close everything and become nationalistic and thump our chests the way many of the strong leaders do, or we can cooperate because truly, if COVID didn't teach us anything, it's that we're all in this together and that we need to work together. And that's going to be even more important as we try to get vaccines and therapeutics.
Thank you, Dr. Pawlowski. Nous allons maintenant à Monsieur.
Next, Mr. Theriault. Go ahead, you have 6 minutes. Thank you, Mr. Speaker. Thank you to our two witnesses. It is a real pleasure to be able to speak to you today. I only have 6 minutes. And with all of the substance that you brought to us today, I would love to be able to speak with you for 6 hours. And so I would encourage you, if you like, to send us a brief with perhaps answers to the questions that we ask you. Your briefs and your witness accounts are very precious to us. My first question is the following, and I'd like to hear from both of you on this. Continental China is grappling with serious contagion. Few people believed that the United States would become the greatest hotspot for the virus on the planet. Given your significant pandemic experience worldwide and your in-depth knowledge of health systems, did you anticipate the strength of this pandemic hitting the United States? We are neighbors. We share the largest border between Canada and the United States. What are the reasons, in your opinion, that explain this?
Jeremy, do you want to go first? I'm happy either way.
I'm happy to take say an initial few words on that, Larry. It's a really great question. I think one of the things that we have seen from many countries is an underestimation of the risk that this disease poses. And I wrote an opinion piece in the Washington Post that was published on the 4th of February, where I called for a no regrets approach. I urged the United States government and really the world to look at what was happening in Wuhan, China at that point, and ask themselves whether it could happen there. Because in my view, as soon as we saw hospitals being overwhelmed in a wealthy metropolis like Wuhan, a city of 11 million people with a very modern healthcare system and a fairly wealthy country, upper middle income country, there was very little reason to think that any developed country, whether that was in North America or Western Europe or anywhere, or East Asia, would be immune to this. And at a minimum, I think we should have been preparing. Every country should have been preparing from that moment for the possibility that the conditions in Wuhan could happen in their own country. And there was no good reason to think that that would not happen. Every country should have been asking themselves on the 23rd of January, when Wuhan began shutting down, 2 simple questions. Could that happen here? And the answer to that in every country was clearly yes. If it could happen in Wuhan, it could happen anywhere. And second, are we ready for that to happen? Are we prepared if that does happen? And that's the idea of a no regrets approach. That was not the approach the United States took. It was not the approach that most countries took. And I think there was a certain magical thinking that somehow what happened in China was happening in China would stay in China. But I don't think there was ever a scientific basis for believing that would be the case. And And so, yeah, I did expect that this could happen in the United States, and was calling for it to be, was calling for preparedness, and was disappointed to see that didn't happen.
Yeah, maybe I'll just, I thought that was a terrific question as well. Thank you very much for asking it in such a gracious way, I might say. The Global Health Security Index, Jeremy and I are both involved in that, had the United States top of the list in terms of health capacities. And the international health regulations require all countries to develop core health system capacities to be able to rapidly detect and respond to novel outbreaks. And so it's a very valid question is why high-income countries in North America, Europe, and Asia were hit so hard. And I think the answer is that health systems are not enough. We actually need to prepare and plan, and we need leadership to actually act, as the Prime Minister of New Zealand says, act hard, act early. And we didn't do that, certainly not in the United States and Europe. Many, many other countries didn't do that. I would come back to what Jeremy said in his opening statement. I was actually quite impressed with it. I'm always impressed with what Jeremy says. But the idea of, and I've said this too, trust is public health 101. You need to get the public's trust. And I know there's something else we haven't discussed, which is kind of the populist undermining of science and experts. And one sees this in the attacks on WHO. One sees it on the undermining and sidelining of the US CDC and now even the White House Coronavirus Task Force. You see it in Brazil and other places. But leadership matters. And so we need two things. We need a strong health system, but we need to take these things seriously and get the public on board with a consistent message of solidarity.
Merci. Thank you, Mr. Merci, Monsieur.
Thank you very much, Mr. Thériault.
Mr. Davies, please go ahead. 6 minutes.
Thank you, Mr. Chair, and thank you to both witnesses for being here. Professor Gostin, if I can start with you. You've written recently that the WHO has achieved so much even with paltry funding. Out of the COVID-19 pandemic, the WHO could be reimagined as a stronger, more responsive international agency. Given the lessons learned from COVID-19, what reforms do you believe are necessary to strengthen the WHO?
I thought you'd never ask. Thank you. There are a number of them. I'll start with sustainable funding. The World Health Organization now has a funding level that's less than one large US hospital, 1/4 of the amount of the US CDC. And it's got a global mandate. But even worse, of the paltry funds that it only has control of about 25 to 30% of its budget. All the rest are directed, they're pet projects. No organization can succeed when it's funded at such a low level and doesn't give it discretion over focusing its resources on global priorities. The second change I would make is just a basic one. The world has the WHO it deserves because it doesn't politically back WHO. It puts WHO in the middle of politics and in political fights. I know I'm working closely with WHO. They're distracted just at the wrong time. So political backing would be a second. And then the third would be to strengthen compliance under the international health regulations, to give WHO tools for independent verification to the extent that we can with state official reports, to be able to partner with countries on the ground, to get more clarity and compliance in terms of its public health recommendations. I realize that those recommendations themselves have been in dispute. And then the process for declaring a public health emergency for international concern. I've said earlier that, WHO is not a perfect organization, and sometimes they can be so frustrating, but they are working really hard, and we need to make them the best global health organization we can make them rather than tearing them down.
Thanks. Now, if I could just drill in a bit on the funding, in a Vanity Fair article, you were quoted as noting that the Trump administration plan to withdraw from the WHO would, quote, probably be the most ruinous presidential decision in modern history, end quote. And you also said in a recent article that if the US were to withdraw, that would leave the prospect of the Bill and Melinda Gates Foundation becoming the WHO's top donor. And you pointed out that if that were the case, leaving a private foundation to be the highest donor, it would be transformational. So I'm going to ask you two questions in one. Can you explain why your opinion that the U.S. decision to withdraw would be so ruinous, and what the implications of leaving the top donor being a private foundation would be?
Yeah, I mean, I think we may hear more imminently from the United States president on this, and I'm not at liberty to disclose exactly. But I now have over 1,000 signatures from the leading public health people in the United States urging Congress to block the withdrawal, because I do believe it would be the most ruinous decision of a president in modern history, to actually just simply turn your back on the World Health Organization. I never thought I would see that in my country. I think it would weaken the global order. It would weaken public health, and I think it would put the United States itself at a higher security risk. WHO, in your second question, they're both fantastic questions. Second question is, WHO is an intergovernmental organization. It's often been called, the world's health democracy, because it's one country, one vote at the World Health Assembly. To think that a private donor, as much as I do admire Bill and Melinda Gates, and they do have their heart in the right place, they're a wonderful foundation of wonderful human beings. Nonetheless, we can't let a private foundation that's unaccountable, not transparent, and has its own preferences, making decisions that could affect global health priorities. We do need countries to step up.
And Chair, do I have time for one more quick question?
20 seconds.
Last, Mr. Gostin, how you mentioned the accessibility of vaccines. How can the international community ensure equitable worldwide distribution of any COVID-19 vaccine or therapeutic that might result in the months and year ahead?
Thank you very much for that question. I'll send you a JAMA article that I co-authored on that very subject. But the idea is that we need to plan for it now. I would like to see that planning under the auspices of the World Health Organization, where all countries pledge to not have a price and intellectual property competition, and to equitably share the vaccine. But it could be under the auspices of the G7, the G20, the United Nations. But I think what we need is a coalition. And I can think of, Canada as being one of the leaders of this coalition, trying to push countries. We need to plan for equity now, before anybody knows that they're going to win the race, because now everybody has an incentive to cooperate. And so we need to plan for that equitable distribution very early on. Thank you so much for those questions. I do appreciate them.
Thank you, Mr. Davies. That ends our first round. We will start now our second round with Mr. Weber. Mr. Weber, please go ahead. 5 minutes.
Thank you, Mr. Chair. Mr. Chair, a point of order. MP Davies took all these fantastic questions of mine and asked them, and now I'm scrambling. So my questions may not be as fantastic as Mr. Davies, so bear with me. My first question is for Mr. Konadijk. I hope I pronounced your name right, Mr. Konadijk. Great. You mentioned that you served in the government and led the Obama administration's response to the 2014 Ebola outbreak. And in a recent Frontline article, you speak about the political pressures public health officials are subject to and the pressure to downplay the bad news. So Canada, as a country who is highly integrated and dependent on a close relationship with the United States, what words of advice do you have for us? Can we trust the U.S. government to provide accurate and fulsome information to us when we need to make key decisions like reopening the border to non-essential travel?
Boy, maybe we could just go back to the other questions you had.
Sure.
No, I think that's a hard question. It's a very important question for Canada. And frankly, it's an important question for the United States. I think, and it is abundantly clear that there has been political pressure curtailing public health advice from the U.S. government. There's no question. The president himself has effectively admitted it. He was asked today.
I'm sorry, Mr. Konadijk, could you hold your mic, please?
I'm sorry. The president was asked just earlier today, was he kidding when he said that that the government should slow down COVID testing? And his response was, I don't kid. So, there is clearly intense political pressure on U.S. public health officials. I still have great confidence in the people of the CDC, the people of the NIH. I think we're not hearing nearly enough from them. And so I trust what I hear from the CDC. I trust what I hear from people like Tony Fauci. I also, but I think you have to triangulate. I think that would be my answer. The CDC is clearly not being allowed to speak in an unfettered way. The last time we heard in an unfettered way from the CDC was late February, when Dr. Nancy Messonnier said that there was going to be a lot of disruption to American lives, and that so upset the White House that they spent the days walking that comment back. But she was, of course, completely correct. And so I would very much like to get back to a point where we can hear that kind of unfettered truth from the CDC again. We haven't heard it in a long time, and they clearly feel very curtailed politically. So I think you have to triangulate on it. But just to complete the point, you have to triangulate between that and what you're hearing from public health commentators in the U.S. more broadly. And I think that's what the U.S. public right now is doing.
And I should say one thing just to add to that. I agree
absolutely
entirely. But I would just say that we obviously, both Jeremy and I are you can tell we have deep concerns about our own government and how it's handled it and how it's muzzled science. There's no question about that. But on the other hand, we also need to express the strengths of the United States. It's not in the White House. It's in civil society. It's in whistleblowers. It's in the CDC. It's in NIH. It's in our community action. And so I do believe that we are, we do have robust institutions. We have a robust civil society, and we need. So we need to remember that President Trump doesn't speak for all of America, and there are many sane voices in the United States that we can listen to.
Well, thank you for that. Back to Mr. Konadijk. In a comment you made, your closing remarks, you talked a bit about international monies not getting into the front lines. Out of $2.5 billion. $2 million of that is going to the frontline organizations, and so 99% of that money, where is it going? Can you give us some clarification there, please?
Yeah, certainly. And it's not to say that the $2.5 billion is not being well spent. it is going to things that are, it is going to really important work that is being done by large UN agencies, and some of that gets second or third hand to frontline local organizations. I think the problem is we can't, that shouldn't be the main thing or the only thing. And I think, and this is a kind of broader critique that I have of the way that humanitarian work is financed, and that's kind of the background that I come out of. The UN agencies do vitally important work, and they're doing vitally important work on this, but they're not the only ones. And I think making them the principal, almost sole recipient of humanitarian financing for COVID, which is the habit that the humanitarian system has had for many years, now being applied to this crisis, is not going to serve us well here. And I think it is very important for donors like Canada, like the United States, to find creative ways and to take some risks, frankly, to take some risks they're not used to taking, because usually there's a comfort blanket in just giving a lot of money to the UN and knowing that they will look after it well. Yeah. To find more creative ways of getting money direct, not just to the UN, but also to those frontline community organizations that don't normally get direct donor money, that usually have a lot of intermediary layers between them. Because they are going to play really vital work. That the lesson we saw in Ebola in West Africa, that those organizations were some of the most credible, the most persuasive, and the most engaged in their local communities. And they need to be, we need to make sure that they're getting the support they need, not just the kind of the big familiar international groups.
Thank you, Mr. Weber.
Great, thank you.
We'll go now to Mr. Fisher. Mr. Fisher, please go ahead. 5 minutes.
Thank you very much, Mr. Chair. Mr. Konendijk, Professor Gostin, you both said that it was a great honor to be here in front of our committee today. I will tell you that the honor is all ours, and I thank you for being here today. When I think of this pandemic, when I think of COVID-19, I think of the faces of public health. I think specifically of the importance of Dr. Tam, the importance of Canada's relationship with the World Health Organization. And I think of the absolute importance, trusting our experts. Now, with regards to a novel virus, of course, we are learning along the way as citizens, as the public, and as health experts. I think of the importance of following science and data rather than politics. So personally, I feel Canadians are very lucky to have Dr. Tam as Canada's Chief Public Health Officer. Professor Gostin, you spoke of public trust and solidarity. At least I believe it was you that spoke of that. How important is it that we continue to trust in science and experts through this pandemic and into the future, assuming that there'll be more?
Yeah, I mean, I think that's really important. For me, trust in science and public health experts begins with really good health communication. And I've been in close touch with WHO about health communication, because we all know about their advice on masks and asymptomatic transmission and things like that. So we're in evolving science. There's a lot. This is a virus we've rarely confronted. It's really pernicious. It's hard to fully understand. And so this is how good public health communication should be. We should honestly, we should trust the public to be honest with them. Tell them what we know, and be clear and consistent on that, without political undermining of the science that we know. Tell them what we don't know, because there's a lot that we still don't quite understand, and then tell them what we're doing to find out what we don't know. If every politician did that, if every scientist did that, we would be in such great shape. You know, the White House at one point in this pandemic asked the CDC, NIH, and others to clear public health messaging with the White House. I would say it would be the exact opposite, that politicians should clear what they say with the scientists. Science is so important, and it's so easy. The media has conspiracy theories, social media. You know, one day something is said, the next day something different is said. But we have to actually rely on science and the objectives of science. Otherwise, we're lost.
if I could just add something quickly on that.
Absolutely.
I think communicating uncertainty has been a weakness of virtually all public health authorities in this response. It's a really core part of good public health communication. I think WHO has not done well enough in proactively communicating uncertainty.
Yeah.
Because with a novel virus, we don't know everything. So at the beginning, what we are working from are the closest parallels that we see. So we were kind of working from what do we know about influenza? What do we know about SARS? What do we know about MERS? Those are the closest things to this virus. So we're going to, we'll recommend what we know about those viruses. And then as we learn more about this one, we can refine. I don't think that process was well explained or well communicated. And it's really important, and this is written into the CDC communications guidelines. It's really important to communicate up front. This is uncertainty. The guidance will change. Bear with us, and you will know what we know as we know it.
Yeah.
Thank you very much, and I couldn't agree more. So much has been said by both witnesses and members of Parliament about the World Health Organization. Now, I expect when this is all over, we can have a post-mortem. We can evaluate how we did as a country. I know you've both mentioned how well Canada has done compared to some countries. Professor Gostin, you had said, and I'll quote you, the World Health Organization Director General must have the freedom to act in the best interest of public health and science without political interference. Do you have anything else that you want to add or to elaborate on that quote?
Yes. I said at the beginning, I've worked with the World Health Organization for a long time. I think a good friend of the World Health Organization is a good friend, and a good friend will tell you when you're wrong, but they won't try to blame you, tear you down, defund you, withdraw their membership, get you in the middle of geopolitical struggles between superpowers. That's not what the world needs right now. We need constructive engagement with the World Health Organization. It's not perfect. We can make it better, but we don't want to tear it down. Anybody who thinks that the solution is to say, my country would have done great if WHO had only done this, that can't be the real world. Because anybody who says we don't need a World Health Organization, when you think of not just COVID-19, polio eradication, safe childbirth, mental health, injury prevention, non-communicable diseases, these diseases are still there. We need a WHO to be more robust when we come out of it, not weakened.
Thank you, Mr. Fisher. We go now to Ms. Jansen. Ms. Jansen, please go ahead, 5 minutes.
Yes, thank you. It's been very fascinating so far this morning. I'm going to be sharing my time with MP Weber, but first, what I've heard so far is that we should trust the experts, and regular citizens are kind of like anti-science bumpkins, and they're going to weaken the global order. I really question that premise, because I would like to read to you an email that I got on January the 29th from a regular constituent in my riding. And he said, MP Jansen, I'm hoping you can urge the government to have a more serious approach to raising the threat level assessment of coronavirus. I'm a screening officer at YVR. Most of the employees in YVR feel strongly we are not prepared to fight or prevent the spread of this virus. Since Health Canada determined the threat level as low, there's no face masks provided to the employees, and the official language is it's not recommended but respected. And that's in regards to a staff's personal choice to wear a mask. We're told to wash our hands more than 20 seconds, but a lot of passengers and employees don't wash their hands, or the soap runs out during peak hours at some of the popular washrooms. Health Canada ensures the public that a healthy person will be safe from a virus by washing his hands often and staying 2 meters away. Currently, that's impossible. That was for him. Our searches do not allow officers to keep 2 meters distance when conducting a search, nor do we have space needed to check at our checkpoints. I know for a fact that a lot of movement flow from YVR staff and inbound and outbound travelers is mixed together in certain areas. While China has gone so far as to lock down cities in other countries like Britain, who stopped flights to and from Beijing, it worries me and other YVR staff to see the Canadian government taking such an optimistic approach for something so contagious and dangerous. We're concerned, and even if we want to help ourselves by wearing our own masks, they're sold out, and I get mocked on my choice of by upper management. Again, you need to understand this was a regular Canadian sending me an email on January 29th asking me to beg that we take this more seriously. So who you tell us we have to trust the experts, but I'm concerned the experts were giving us the wrong information.
Jeremy, do you want me to answer that, or would you prefer to?
I have some thoughts, but if you want to take the first swing.
Okay, thanks. I don't think any of us said quite what you suggested that we said. I don't think that science or experts come down from on high, on Almighty, and know all the answers. This is a process that we need to learn together and understand. And we don't. I mean, even what we want to do is you and all the members, all the members of this committee, and all of Canadians, we really have the same objectives. We really want to find out the best way of doing this. I don't know all of the details of what Health Canada is saying. If they're saying, you can be absolutely safe, I'd be very surprised if they said that, by doing X, Y, and Z, then that would not be right. But what they can say is this. This is what we know, is that if there's universal mask use, if there's social distancing, if there's really good hand hygiene, that we will have a reduced risk. Right now, I'm
right. Sorry, my time is a bit limited, so I just want to point out that universal mask usage was not recommended by WHO or by Canada Health for far past January 29th, and that is the concern. If a regular fellow in my constituency wants to wear a mask, he should be able to wear a mask, and it would have made a whole lot more sense. But I want to make sure that Mr. Weber has time, so if I could please pass it on to him.
Oh, that's fine, MP Jansen. Mr. Konadijk, you had some comments to make on that?
Sure. Yeah, I think the mask thing, probably more than anything else, is an area where the guidance has shifted, and the reason, I think it's important to understand why. So in the early phases of this virus, we knew almost nothing about it, and the public health guidance that was coming out at that point was based on the closest parallels that were available, and it was also guided by the fact that there was not in public perception a distinction between medical and non-medical masks.
But under the circumstances, would it not have been wise, out of the abundance of caution, to use a mask? Why were we not able to?
Ms. Jansen, you no longer have the floor. Mr. Weber has the floor. Mr. Weber, please carry on.
Okay, well, I'm going to pass my questions back to MP Jansen then.
Well, thank you, Ms. Jansen. Ms. Jansen, your time is up. We go now to Dr. Jaksic. Dr. Jaksic, please go ahead.
Well, thank you very much. And the analysis that both of you witnesses has given us has been very, very insightful, I think, for all of us who've been following, obviously, this pandemic now for a number of months. And I assure you, I'll give you plenty of time to answer my questions. I was in public health practice as a local medical officer of health for nearly 2 decades. And certainly the communication of risk and people's perception of risk does vary tremendously. And it's very difficult to actually communicate that. Professor Gostin, you started by talking about trusting the experts, making sure that people understand that a lot is unknown and that you are trying to communicate honestly and so on. At this point in time, going forward, what do you see as the role of the WHO in communicating risk, in making sure that people voluntarily adopt physical distancing and the public health measures that are recommended? Can you give us what you would see an ideal way forward?
Yeah, I mean, WHO is in a more difficult position in terms of risk communication and health advice than a national government would be, because their advice goes to every country. And so you might, I think Jeremy was right. The mask issue was because of evolving science. Some of it we just didn't really realize that it was such a risk mitigation measure, and particularly because there was asymptomatic transmission going on. But on the other hand, there are some countries where mask use is not as easy and effective as it would be in other countries, and so WHO is in a difficult position. But my advice to WHO, and I'll state it publicly, that they know it, is exactly what I'd said before. To actually state honestly what we know, what we don't know, express that uncertainty. Anybody who tells you that we're sure of something in this COVID-19 pandemic, you need to take with a grain of salt. I've said to myself, Larry, can't get my health set on the head. We have to approach this virus with some humility. That doesn't mean we ignore science. We have to double down on science to try to find out the answers to this. But we do have to have humility, and we don't want to be preachy. We want to explain what levels of uncertainty are, understanding that people do have different risk tolerations and different risk perceptions. They absolutely do. All the science tells us that.
Mr. Conondike, would you have anything to add?
Yeah, I agree with Larry. I mean, I think, partly what we're seeing here is this is the process of science playing out. We start with a lot of uncertainty. We make a best guess based on the closest parallels that we have. And there's a real challenge in public health communication between providing that information in a way that is authoritative without being overconfident or without being misleading. And I think that is not, I don't think, frankly, much of the world has done a good enough job of communicating that uncertainty. And as we understand more about the science of the disease, the recommendations evolve and change. And I think that's what you're seeing. So that, we are finding that to control COVID, we need to do different things than we needed to do to control SARS, because the SARS did not have the kind of asymptomatic transmission that we're seeing here, and different than what we needed to do to control flu. But at the beginning, we had no way of knowing that. So, recommendations were based on the closest known parallels that we had. As we gather more data and more information, those recommendations have evolved. And I think that is a difficult thing. If you're a member of the public only paying kind of partial attention to this, and you see those changing recommendations without really understanding the rationale behind them, it is confusing. It does undermine trust.
In Canada, we have another complication in that, of course, we have a very vast country, different geography, different demographics. And one of the issues where I think perhaps public trust was somewhat eroded was that there was a lack of consistency in public health guidelines in terms of allowable behaviors, even now as we're opening up the economy. And so there has been some suggestion that we would be best served with some national standards, at least. And in a way, you alluded to, I think, Mr. Conondike, a little bit to gradations within public health emergency standards, so that it's fairly clear that different jurisdictions might have different responses depending on where they are within the emergency gradation, so to speak. What do you have some comment, Mr. Conondike, on how a vast country like Canada might ensure some more consistency?
Absolutely, and we are struggling with the exact same problem here. I think one of the challenges with this is it hits different places at different times, due to reasons we don't yet fully understand. And so it's kind of easy for the areas that, in the United States that locked down earlier, so locked down before they had a raging crisis, to then, to look at that, and rather than thinking they dodged a bullet, to think they were bulletproof. And I think some of the states that now reopened, in my view, too early and too recklessly, are paying a real penalty for that. Arizona is about to have its hospitals overwhelmed, as are parts of Texas, and I think Florida is not far behind. And the reason for that was they assumed that there was some difference inherent in their states that meant they were not going to face the same sort of situation that New York faced eventually, or that this problem was unique to New York. And I think there are absolutely differences. There are gradations, but the fundamental thing we know is that if you give this virus oxygen, it will burn you down. And if you do not have some way of controlling it, and you can't sustain a lockdown forever, and you shouldn't need to. And I think what we see from South Korea and Hong Kong and Taiwan and some of the better performers in East Asia is if you have good testing, tracing, strong public health measures, and you're following the science, you don't need these long-term, very crushing lockdowns. But you have to pass the baton to something if you're not going to keep the social distancing measures in place. And if you lift social distancing without having the other measures in place, as much of the US is doing, that's disastrous.
I might just add two dimensions to this as well, because Canada and the United States, other countries like Russia, are federalist countries. And so how do you deal with a pandemic in a country that divides its powers and its influence among various jurisdictions? Often federalism has strengths because you can have local innovation, local experimentation, but you also need a consistent, as you said, a consistent national guidance and consistent national response. Because if there's a fire in one place, it will spread to other places. And so you do need that federal leadership. The other thing we're seeing in Canada and the United States and Brazil, many other places, is a political and cultural divide. A virus should be make us all think, well, it doesn't matter, what political party we are, what ideology, whether we're rural or urban, what our culture is. We need to, respect that virus the same way. But somehow this has become a political, cultural symbol. That's very unhelpful when we start to do that.
Thank you, Dr. Jaksic.
Thank you.
Nous allons maintenant à Monsieur.
We will now move on to Mr. Thériault or Mr. Desilets. I think it's Mr. Thériault. Yes, it's me. Go ahead. You have 2.5 minutes. 2.5 minutes. Very well. There are more than 9 million people who are infected, more than 472,000 deaths in the U.S., more than 2.3 million infected individuals. So a fourth of the Quebec population. We don't have any antiviral drugs. We don't have any vaccine. We have a strategy that isn't deployed fully, no serology testing. In brief, we know very little about the virus. We are in a lull right now. What concerns me is deconfinement. There are few public health reasons justifying a quick deconfinement. The deconfinement motivations are socioeconomic. They're not based on health or science. So what measures should we undertake now in this context based on what you explained earlier, Mr. Konendijk, with regard to rich countries, poor countries, if we don't want to see a reemergence of an even worse second wave universally, what should we be doing?
That is the biggest question that I think every country is facing right now. I would say a few things. I think first, the kind of the lifting of confinement or stay-at-home orders needs to be very cautious, very gradual, and driven by data. So if some measures are lifted, it does not provoke a spike in the virus, then go to the next phase, wait, stop, make sure it does not cause another spike in the virus. Have clear. So I've worked with others, with other colleagues here in the U.S. and laying out a series of recommended steps for local areas to determine whether they are ready to safely reopen. And that is based on a range of things. You need to understand what the virus is doing locally. What is the status of the local outbreak? Has incidence come down to a low absolute level? Is testing positivity down at a low absolute level first? Second, is there enough testing and contact tracing capacity in place to then manage the spread of the virus that way, so that if you see a rise in cases, you can use testing and contact tracing to begin containing that. Is there readiness in the hospital system for a future wave in cases? These are all the sort of measures that need to be in place in order to safely reopen. And then, by all means, a conditions-based reopening with safety measures in place to contain the virus through other means. What's dangerous is a reopening that is not based on clear conditions and does not have the tools to contain the virus through other means once the social distancing measures are relaxed. The last thing I would say is I think what we are coming to learn about this virus is super spreading events. These events where large numbers of people in an enclosed space become exposed in a single event are probably the most dangerous and aggressive way that this virus spreads. So those are the sorts of things that should be among the final last things to reopen only once the virus is almost totally suppressed.
Merci, Monsieur Thériault.
Thank you, Mr. Thériault.
Mr. Davies. Mr. Davies, please go ahead. Two and a half minutes.
Thank you. Well, I really appreciate the refreshing and frank advice. I can tell you that it really resonates with me that one of the lessons I think we ought to learn out of this is the need for our public health officials to express uncertainty. And I think almost every country is guilty of that to some degree. I know, President Trump talked about opening by Easter. China, of course, famously didn't report it.
Mr. Davies, are you there? Looks like your line is frozen up, or your session is frozen. We will suspend the meeting for a brief time while we get Mr. Davies sorted out. Mr. Davies, after a technical issue. Please carry on, Mr. Davies.
Hi, sorry about that. I'm not sure where I left off, but just sort of bringing a whole bunch of threads together. I think it's very accurate to say that this was a novel virus. We were sort of feeling our way through. And of course, the essence of science, reliably predict and replicate results in a predictable fashion, which is difficult to do. If I take the example of masks, where we were strongly advised not only not to use them, but that they would be harmful. What my question is coming out of this as a lesson for the WHO, where does the precautionary principle intersect with science? If the WHO were to say, look, we're not quite sure about the efficacy of masks, but it has been helpful in reducing the transmission of droplet-based illnesses, so we would recommend that you use that if you want, as opposed to a hard no. Is that one of the lessons that comes out of this, is that perhaps we need to adjust the public health advice that we give when we're not exactly sure?
I think I'll take a swing at that. I think that's a fantastic question. And one of the challenges with the masking was early on, we knew that masks, medical grade masks, were needed for health facilities to keep healthcare workers safe. We knew there were not enough of them. And we knew that masking guidance was being interpreted by the general public as go buy an N95 mask from your hardware store, because these are very common masks. Many people would normally have them. And so I think that I would say there was an overreaction early on to try and deter people from buying masks, because they were buying masks that were basically competing with critical healthcare supplies. There should have been a much better job done, and I think this is a takeaway lesson. There should have been a better job done of distinguishing between medical and non-medical grade masks, saying do not buy medical grade. And there was some of this, but it was not forthright enough. And expressing that the science on the value of masking in the general population was uncertain. The science on the value of masking in a medical situation was certain. And that was what we were going on initially. As the understanding of the virus changed, that evolved. But I would agree. I don't think that was well enough explained. And I think there are lessons there for the future about how that uncertainty and the state of the evidence, the state of understanding is communicated with the public going forward.
Thank you, Mr. Davies.
Thank you.
That wraps up round two and wraps up our first panel. I thank the witnesses. You've been enormously helpful. We certainly appreciate your time and your expertise. Thank you for being here. With that, we will suspend as we bring in our next panel. He's now resumed. So I'd like to welcome the members back. Welcome to the witnesses to meeting number 30 of the House of Commons Standing Committee on Health. Pursuant to the order of reference of May 26, 2020, the committee is resuming its briefing on the Canadian response to the outbreak of the coronavirus. I would like to make a few comments for the benefit of the new witnesses. Before speaking, please wait until you are recognized by name. During questioning, the questioner will signal to whom the question is addressed. When you are ready to speak, you can click on the microphone icon to activate your mic. I remind everyone that all comments should be addressed through the chair. Interpretation in this video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen of either the floor, English, or French. As you are speaking, if you plan to alternate from one language to the other, you will need to also switch the interpretation channel so that it aligns with the language you are speaking. You may want to allow for a short pause when switching languages. When you are not speaking, your mic should be on mute. So I'd like now to welcome our second panel of witnesses. From Statistics Korea, we have Asaph Young-chan, Asaph Young-chun. Mr. Chun is Director General, Statistics Research Institute, Anyang Hasayo. We have from the Taipei Economic and Cultural Office in Canada, we have Mr. Winston Wenyi Chen and Nin Hao. And thank you, both of you, for being here. You each will have time for a 10-minute statement, and we will start with Statistics Korea. Mr. Chun, please go ahead. 10 minutes, please.
Okay, I'm so honored to be speaking with Canadian House of Commons at the invitation of the Health Standing Committee. So actually, I prepared the PowerPoint, the slides, but I just was informed that I think it is not possible to share my screen at the moment. So I'll just rely on perhaps some of the talking points rather than a number of data visualizations that I thought may be more informative to this committee. So I think I'll just use the slides as a kind of my talking points. And just as a kind of background, I think I titled my remarks as the nudging data and science-based exit policy. And I'm going to talk about partnership lessons from the crucible of pandemic crisis. And that is the sort of theme of my the remarks today. So what do I mean by this title to begin with? I think this is the crisis that Canadians, Koreans, and people across the globe are facing at the same time. And I consider this is the crucible because this is the trial that we can bear with, and then we can learn the lessons. And Korea and then Canada has crafted very good partnership since last March. And I'm going to talk about some of those partnership and lessons that we have learned from it. And then that partnership is actually based on data and then science. And that's the point, the main point that I'm going to talk about. And why science-based policymaking? This is a sort of, I think, the very important, I think the best practice that I consider critical policymaking. I think in today's the 21st century, we need to have evidence, data, or the science to inform our policymaking. That includes this COVID-19, health policymaking that we all consider very important. So I'm going to make 3 points at least in this the short presentation. The first point is about this data and science-based best practices to flatten the epidemic curve. Second, I'm going to talk about what are the sort of innovation and then the future that we need to plan in the post-corona period. And last, I'm going to talk about sort of partnership ideas that I can suggest between Canada and then Korea to deal with this coronavirus 19. But also, I think some additional collaboration that we can partake together. So in March, as I just briefly mentioned, Statistics Research Institute and the University of Toronto, especially David Fishman's research team, have worked together to model and then predict the life course of this COVID-19, especially in Korea. And this was the time very critical to 51 million people in Korea, and back in February and in March. And as a Director General of the Statistics Research Institute, I've been already forming the good ground for a lot of good people to work together. And we needed some, I think, the scholars and then modelers to work together. And David Fishman was very generous and very willing on the request that I proposed. And then we worked together and then to model and then predict the life course of this COVID-19. So in the past, I think the several months, we've been working together to plan a lot of these details about, what is the high point of this.
Excusez-moi.
Yes.
Excusez-moi de vous interrompre, Madame la greffière. Il n'y a pas de traduction.
I'm sorry to interrupt you. There hasn't been any interpretation for a while.
Interpretation has stopped. It's with sound issues, it's very difficult for interpretation. I wonder if you are able to maybe speak louder, perhaps. It might help. Perhaps if you could just try a few sentences. Just back up a bit and continue your statement from that point, if you could. Please go ahead. We'll try and we'll see if interpretation is available at this point. Thank you.
Oh, okay. I'll try, and then I'll perhaps to speak slowly and then loud, and then so the interpreter can catch it. So I was discussing about sort of this, the science and then database, the partnership. The scholars in Korea and then Canada have worked together in the past several months to model and then life course of this COVID-19 and then predict, what is the actual course of this COVID-19, so we can plan our policy making accordingly in advance. And that is the point. When you have, I think the certain data, and then the pattern of this COVID-19 for the rest of its, I think the life course, and we can plan things, I think, the better. So that is the sort of partnership that we have had together, and we've been very successful, actually, to predict the life course of this COVID-19 in Korea. And we have had about 8 modelings so far together to put this, I think, the life course in a very, I think, reasonable level of certainty. And in this process, I think a few things that I like to share is that, so once we know, I think the life course of this COVID-19, and what are the things that we could do?
I'm sorry, Mr. Chun, the interpretation has stopped again.
Excusez-moi.
Yes. Erica, Madam Clerk, can you advise here what
Mr. Chair, if you could suspend the meeting for a few minutes, we'll work on it.
Very well. The meeting is suspended. So due to some technical issues with Mr. Mr. Chun, Mr. Chun will be rejoining us later. We will carry on with Mr. Chen. Mr. Chen, please go ahead with your statement. 10 minutes, please.
Thank you. Good afternoon, Mr. Chair and an honorable member of Standing Committee on Health. It is my great honor to provide a statement before this committee on such an important topic during such a challenging time. It is my hope that during the course of this discussion, I may be able to provide some insight as to how Taiwan has approached its fight against COVID-19, and that we may have the opportunity to discuss how countries like Canada and Taiwan can share their experiences to better combat this virus. Allow me to take a moment to reflect upon Taiwan's experience. Despite proximity, close trade ties, and tourist exchange with China, Taiwan avoided the worst consequences of the pandemic. Indeed, with only 446 confirmed cases 7 days, and then 72 straight days without local transmission, Taiwan's success has allowed school and the business to remain largely open and operational as normal. As Taiwan is neither a member nor an observer of the World Health Organization, this was all accomplished without the timely access to critical information that many other countries have benefited from. How then was Taiwan able to successfully fight the disease? First, our fight began before the enemy was even present. Following the hard lessons of the 2003 SARS outbreak, Taiwan comprehensively reformed how it prepared for and would respond to eventual outbreaks. Another key to our success was our government's quick and decisive action at the very beginning. When our Center for Disease Control learned of atypical pneumonia cases in Wuhan, we began actively screening passengers as they arrived in Taiwan. This action started on December 31st, 2019, more than 3 weeks before Wuhan entered its lockdown period. At the same time, Taiwan warned the WHO about a potential novel virus in Wuhan with human-to-human transmission. Regrettably, this warning was ignored. and the global community lost valuable time in terms of preparing for and combating virus. It must be stressed that Taiwan's exclusion from the WHO remains an impediment to global health. So we are grateful for parliamentarians in Canada and throughout the world who have supported Taiwan's meaningful inclusion in this organization and other international fora. As the situation in Wuhan worsened, the government of Taiwan activated its Central Epidemic Commanding Center, or CECC. The CECC established a clear chain of command, began holding press briefings that disseminated accurate, up-to-date, and transparent information to the public a full 3 days before Wuhan entered its lockdown. Moreover, the CECC was led by medical experts who jointly held important political offices, namely Minister of Health and Welfare, Dr. Chen Shizhong, served as the chief for our CECC, holding daily press briefing as coordinate all public efforts at the national level. Our approach to combating the disease and informing the public was proactive and aggressive. This had the dual effects of stemming the virus early and combating disinformation by gaining the public's trust. Over the course of pandemic, the CECC has initiated more than 120 COVID-19 countermeasures. This including various restrictions on movement and travel, health screening at points of entry, mandatory self-isolation, and much more. The CECC also coordinates communication in an orderly and a clear fashion so as to provide real-time and most accurate information. Moreover, we apply innovative data-driven information technology solutions to track the spread of the virus, combat community transmission, and then allow citizens to have up-to-date information on the availability of crucial supplies to avoid panic buying. This was only possible through the consolidation of real-time data from a variety of government ministries and then through the active cooperation of Taiwanese citizens. Importantly, Taiwan made every effort to secure its supply chain for crucial medical goods, such as masks. We implement a system whereby each citizen was provided with a stable allotment of masks, while production was simultaneously ramped up so that we could maintain steady supply of PPE, personal protective equipment, for our citizens and then healthcare workers. Taiwan's strategy has allowed for a daily production of up to 20 million masks. This has meant that our government has been able to provide masks and other crucial medical supplies to countries around the world, including this country of Canada. Today, we have contributed 1.5 million surgical masks, 100,000 N95 masks, and then another 100,000 protective and isolation gowns to Canada in total through the Canadian Red Cross to distribute to frontline healthcare workers and the indigenous communities. We believe that it is imperative that countries that have the means to help one another do so openly, graciously, and then cooperatively. Taiwan is striving to do precisely that. In terms of what can be done to further this cooperation, it is useful to consider the joint partnership that our government has engaged with other countries. For instance, Taiwan is conducting joint research and development of rapid tests, vaccine, treatment, information technology, and more with our partner in the United States. We also maintain agreements with a variety of countries to ensure the stable access to important medical supplies. In any case, Taiwan stands ready to cooperate openly and in good faith with the government of Canada. In that spirit, it is our hope that countries like Canada can work with Taiwan to develop shared solutions. By working in concert with one another, I'm sure that our two countries can promote better health outcomes for our society and the world at large. Honorable Chair and members of the committee, on behalf of Taiwan, I would like to express my sincere gratitude for your time and thoughtful consideration. And I look forward to taking your question later. Thank you. Merci. 谢谢.
Madam Chair, are we ready with Mr. Chun again? Or shall we break and test his sound?
Mr. Chair, I would suggest a quick suspension just to double check the sound.
Very well. The meeting is now suspended. Thank you. Resumed. I will invite Mr. Chun to carry on with his statement. Please go ahead, Mr. Chun.
Okay. Let me get back to one of the main points to repeat myself. So I'm going to talk about 3 pointers in my presentation. The first, I'll talk about this partnership activities that we have done together between scholars and officials of Korean and Canadian government since last March. And second, I'll talk about, based on this partnership that we have crafted, especially as we are going through this difficult time across the Pacific, across the Atlantic, and across the globe. What is the sort of exit strategy that we need to actually, I think, come up with? So I'm going to talk about sort of this data science and AI-based innovation and then digital economy. And finally, I'll talk about, so what next steps that can we take to further, I think, enlarge this Korea and then Canada partnership sort of as accelerator. So first, when it comes to the first point of this partnership between Canada and then Korea in the past several months, I'll talk about this, I think, the important modeling activities that we have done so we can plan things accordingly. So Professor David Fishman and his research team based at University of Toronto and the Statistics Research Institute and many other research institutions based here in Korea, we have worked together since last March. And so we can actually model the course of this, the pandemic, and then forecast with, I think, the marginal better. And so we can plan a lot of things in advance. And as I recollect, the past several months, this so-called idea-based, that the model has been working pretty well. And we are able to forecast, what is the maximum number of the new cases that we might have across the Korea and then in certain regions. When will be the lowest point of the daily cases that we are going to have? And so we can plan a lot of these non-pharmaceutical interventions accordingly. Because when you know this near future, and then you are in good shape and to plan a lot of policy makings better. For example, when it comes to the school opening, when you know how serious this epidemic is going to be, and the extent to which this is going to impact families and then kids, and you can plan, I think all this online and off school, I think the openings better. When it comes to teleworking, again, when you have this kind of information, you can encourage some of those teleworking more rather than later. And when it comes to some other, the mass gatherings, when you know this course of the epidemic, and you can find when is the good time to encourage stopping any of those mass gatherings, when is the good time to allow many of those mass gatherings, so we can have good economy still going on. So that is the sort of main, I think, lessons, and then I think the benefits that we have earned from each other when we did this modeling together. And my colleague, David Fishman, and his research team also has picked up what we have gone through in the past several months when it comes to this non-pharmaceutical interventions. So this was sort of, I think, the give and take, and very, I think, a healthy exchange and partnership, so we can learn from each other and we can handle our crisis better with data and then evidence and then science-based approaches. I'll talk a little bit about this sort of non-pharmaceutical intervention that I think we have actually institutionalized, or I think they made sort of best practice among the public. When we knew the three factors that affect this effect of the non-pharmaceutical interventions, we try to actually reduce probability of infection at the person level by encouraging the use of masks from the start, back in February, and hand washing hygiene. Second, when it comes to societal level sort of non-pharmaceutical intervention, we knew social distancing should be very effective measure. So rather than waiting, I think we actually had sort of proactive, I think proactive sort of, I think, implementation of social distancing, like a virtual education, teleworking, and then preventing mass gatherings way in advance back in March. So this epidemic would not be, I think, as large as other countries have gone through. Third, sort of this government level, I think, intervention by using the 3T with testing kits, ICT-based tracing mechanism, and then treating patients with very good practice. And we call this sort of 3T framework. And it has been working pretty well based on ICT-based tools, AI-based, I think, the guidance, and then a lot of these innovations that we started way in advance. So that's the sort of, I think, the main point. And when it comes to the second point that I was going to tell you about, so what is the sort of exit strategy that we are considering at the moment? We've been actually discussing about the so-called dynamic distancing. So once you know this, I think the cycle is going to kind of going down, but you're still uncertain whether this is going to come back. But you have this economy that you need to manage. So you cannot simply lock down the whole country, or you cannot continue to have a lot of the social distancing. So we have come up with this sort of dynamic distancing on and off. So we keep the balancing between, some, I think, the good component of economy keep going. And we have some of those, I think, the moderate level of the social distancing, while we have some other personal level and government level sort of intervention in place. And that's what we call dynamic distancing. And it's been working, I think, pretty well so far.
Mr. Chen, I apologize,
Yes.
but I wonder if you could wrap it up very soon.
Okay, sure. So that's the idea that we are currently actually experimenting in real time, and there are a lot of uncertainty here and there. But I think the Canada and then Korea, we've been working together to learn this is actually going to work. My last point is this is not the end of a partnership. I think that we have a lot of additional partnership that we can continue. So we can plan for this post-corona sort of period by working together with AI and data science-based, I think, innovation, and also some policy, I think, the collaboration when it comes to stemming the second wave or multiple wave of this coronavirus. There are a lot of other things that we can talk about, but I'll stop here and then listen to your questions so I can answer.
감사합니다. Thank you.
Thank you.
So we will now start our questioning. We will only have time, unfortunately, for one round of questions. We will do 6-minute rounds or 6-minute time slots. We will start with Dr. Kitchen. Dr. Kitchen, please go ahead.
Point of order, Mr. Chair. Just a brief point of order. Given the technical problems and this happens, I understand it's nobody's fault, but I wonder if these witnesses could be brought back at a later date in order to take further questions. The experience of Taiwan and South Korea has been so critical to our understanding of what needs to be done. And I think there'd be a consensus to give them another opportunity for further questioning at a later date.
Thank you, Mr. Dennis, for your point. We will take it up as a committee in due course. But thank you for your intervention. I apologize. We're not going to have a second round here. We just don't have the time. So, Mr. Kitchen or Dr. Kitchen, please go ahead. 6 minutes.
Thank you, Mr. Chair. And I agree with my colleague's point of order, and hopefully that will be discussed. Thank you, both gentlemen, for being here today. It's greatly appreciated. And first of all, I would like to thank Ambassador Chen for your contribution or Taiwan's contribution of PPE to Canada. It was greatly appreciated, and thank you for stepping up and doing that. My first question is to you, Your Excellency. Taiwan leads the world as the most prepared and best equipped nation to fight the pandemic. We've seen Taiwan can help, and Taiwan is helping. Could you describe what roles Taiwan can play in this unprecedentedly challenging environment?
Thank you. I think the pandemic is COVID-19 is really a challenge, not only to my country, but also to Canada and the others around the world. So at this time, I think for Taiwan, we try everything we can with our resources and power, and then work together with our international partner, make sure to protect the life of our citizens. And given the real situation is that we are not the members of the World Health Organization. And then everybody understands that virus, they knows no border. And then we cannot just do our part by ourselves. It needs and it takes a lot of cooperation and with neighboring countries and the international society. That's the reason why we government and the people in Taiwan from time to time. And we want to engage with the international community. Particularly in this pandemic, we noticed that our experience can be shared with our friends, particularly people nowadays talking about Taiwan models. And then with that in mind, I'd love to take a few minutes to share with what is the real nature of Taiwan models. And in fact, make a long story short, is that number one, pre-pandemic preparedness. And the second is quick, coordinate, and proactive decision-making. And the third is health forward policy making, including by instituting border control, health check at all points of entry and more. And four is application of big data, artificial intelligence, and then technology broadly. And the five is management of the production, purchase, and then dissemination of critical medical supplies. Six is open, accurate, timely, and transparent dissemination of information. And the number seven is productive and good faith international cooperation. And in fact, if we can use three words to describe it, it's transparency, technology, and then teamwork.
Thank you very much. The infectious disease expert, Dr. Ronald St. John, has recently been quoted as saying he personally thinks Canada's response to COVID-19 in January was a bit slow, and also stated it probably should have been taken a little bit more seriously. I will point out that Dr. St. John was the first Director General of the Centre for Emergency Preparedness and Response at the Public Health Agency of Canada and the National Manager for Canada's response to SARS. How important was speed when it came to the responses from Taiwan and South Korea? Mr. Chen?
I think, as I mentioned earlier, given the proximity and then close exchange between Taiwan and China, I think for government people in Taiwan, I think to prevent the spread of the virus in the early stage, I think that's essential, and that's something I think the government have to take the quick decision, and we did that.
Thank you, Mr. Xu.
Okay, I think all the preparation, I think it's just very essential, especially when you know, when you have some information about this is actually asymptomatic, the epidemic. So you got to have very good tools in your hands when it comes to testing and then tracing mechanism. And this is critical to the entire process of the prevention. So this is where I think the Korea, I think it was able to come up with some, I think, the innovative way of testing and then tracing way back in February by creating some partnership between government and then industry together. So we actually gave more leadership to the industry so they can come up with the innovative way of testing and then tracing.
Thank you, Mr. Chu. Following the SARS pandemic in 2003, most countries developed pandemic response plans that could be put in place almost immediately. And we've seen in Canada that Canada struggled with this, even though that's part of the Public Health Agency of Canada was created to deal with that response to SARS. Part of what they talked about is preparing about doing drills and simulations. Did your governments ever conduct reviews, drills, or practices run by for a pandemic response plan? Mr. Xu?
I would not necessarily say it was the drills, but I think the more important thing here is that I think we came up with what are the sort of legal framework that we can use, so we can help the population to go through difficult time together, and they can actually I think they work with some of those, I think this individual liberty versus, this collective sort of, I think the group of the life at stake. And then can you handle that kind of balance? And this was the very important legal framework that actually the Korea was able to handle when Korean people went through that, the SARS and then MERS, the crisis in the past. And so
Mr. Chen, can we get a quick answer?
Yes, that is my response.
Thank you.
Thank you, Dr. Kitchen. We'll go now
I
to.
think the.
Go ahead, you.
Yeah, I
Mr.
think
Chen?
in Taiwan's case that I think we, in general public and the government, we have a consensus that because we have a hard lesson, we learned a hard lesson from the SARS 2003. So and we are isolated from the international health community. So we believe that we have to respond quickly based on the science evidence and then expert advice. And we not necessarily have a drill, but we have the legal framework already in place after the 2003 SARS. That's the reason why we can quickly establish the CECC and to mobilize the private sector and the government agency and work together as a team and then respond properly and quickly. And also that I think as a democracy, I think people is certainly worried about the loss of even that's a very limited one. They worry about the loss of the security and also the safety in this pandemic. And then I think that's the reason why government can get the trust of the people. But make sure that you have to be openness and transparent and a lot of communication, and then that will be certainly give the government more power to continue to proceed the mechanism which is required.
Thank you, Mr. Chen. We'll go now to Mr. Van Bynen. Mr. Van Bynen, please go ahead, 6 minutes.
Thank you, Mr. Chair, and thank you for the witnesses for participating today. The idea of a greater pan-Canadian network has been a recurring topic of conversation during these committee meetings. Witnesses have repeatedly stated that such an approach would increase collaboration in the health systems across Canada to the benefit of the whole country. And I hear Mr. Chen had indicated that what was important was a clear chain of command. So is there such a network in South Korea or in Taiwan? And if so, could you elaborate on how it was implemented and whether it has benefited your country's health system? And if not, why you would say such a network has not been used? And I would invite a response from both of our witnesses, please.
Probably I can go first. I think speaking of this past experience and crisis that we had to deal with, I think the SARS and MERS, Korea was able to actually institutionalize sort of very, I think, the good sort of, the system of the governance when it comes to the crisis management. So I think even for this pandemic, so learning from those past lessons, we had sort of this very centralized system of who is controlling this whole crisis, and who is going to actually specialize in dealing with a lot of those, actual the issues on the ground, and then how the central government and the local governments need to work together. So all those systems have been already in place, and so the Korean government did not take any time to actually plan and implement all those things. Just I think in less than 24 hours. And then that was the sort of system that I think they were able to actually reinstitutionalize when we had this crisis really coming up on us, and then use that to deal with this crisis in a very proactive way, because we didn't have time to have any sort of discord between the central and the local governments, and then a lot of coordination was already in place, institutionalized.
Mr. Chen? Mr. Chen?
Yes, I think in later part of January, our CCC has been well established, and the health minister is in charge of this on daily basis, giving the briefing and the explain to the citizen the real situation about what's going on and then what's the new regulation and mechanism is in place. I think that's helped people a lot, and they know how to to get the PPE and in the convenience store, and then by using the big data, I think the government can control very limited number of the confirmed cases, make sure that they are well placed for the quarantine. And for the suspicious cases, also the people know how to behave themselves to self-quarantine or self-isolation. I think that's it's a kind of a teamwork, and people have a sense of a crisis, and then they know how to do the thing for the public good. And there is a debate in the society that by using the modern technology, and then people, particularly for a democracy like Taiwan, they worry about they lost their secrecy or their privacy, and how to make the balance of this extremely important for the democratic institution. So in this area, I think our parliament play a very important role, and the regulation they on daily basis they check government's mechanism or new regulation, make sure that people's privacy is can secure, and then people's right for the civic society, and then they can guarantee that we can handle the pandemic properly. But in the meantime, we are not going to lose the most precious principle and the things in the democratic society, that's our privacy and our civil rights.
Thank you. Now, it's great to see that both of you are now working with Canada on some research project. But based on your country's experiences, do you have any lessons learned or any suggestions for Canada as we move forward to reopening the economy? And we'll start with Mr. Chen again.
Perhaps I can.
Sure. No, go ahead.
Yeah, I can speak first. So again, Canadians, Koreans, and then other people really eager to reopen and revitalize the economy. And this is actually very critical to many people, especially the disadvantaged people in particular, economy-wise, and also in other ways. But I think that you got to have sort of the system in ready before you actually reopen a lot of economic sectors. If you do not have a good system in place like this, testing, tracing, and then treating patients with a very good health system, then I think you'll certainly experience, I think, a resurge of this, I think the pandemic, and that is what other countries have been experiencing. Even in Korea, I think in the past few weeks, we've been very concerned. Once we have relaxed some of those social distancing and going after dynamic distancing, and so the people can have more economic activities, and we kind of noticed that I think some of those I think the cases are coming back, and then haunting some people in certain communities. But we were to some extent pretty confident that we have a good system in place. Again, going back to this 3T, the system, and also we had the trust between government and then public, and so we can rely on each other. So if we have those in control, and if this, I think the public health, the infrastructure, very resilient, and then if it is, I think the crisis is, I think within that, I think the threshold, then you can certainly be prepared to reopen certain areas of your economic sectors. But I would recommend that you do it step by step, gradually, not the complete opening of everything at the same time.
Thank you, Mr. Chen. Oh,
Mr. Van Bynen, your time is up, but Mr. Chen may respond if he wishes. Please go ahead.
Yes, I make a long story short, and I think how to revive our economy in the post-pandemic period is extremely important, and our country also pay very much attention to how to reshape our economy model and how to revive the spirit of the economic power. Make sure that the society can sustainably develop. That's extremely important. I think in the last 3-4 months, for business community in Taiwan, although domestically we business as always, but for sure that international tourists from abroad have been stopped from the borderline. They are not allowed to visit. So at this point, that the government make it very clear that they select 15 countries, and in the first stage to allow business people from those 15 countries to visit Taiwan, and to make the isolation time as short as possible, 5 to 7 days, and then to encourage the business community, they can continue to come to Taiwan, to engage with Taiwan. But I totally agree. Director General Shen's mentioned that we have to do that gradually, state by state, and then make sure that the pandemic won't be come back the second times. That's extremely important. And the how to balance of this, well, certainly that's each country has its model. As I said earlier, I try to portray the real model of Taiwan to you, but Taiwan's model is not perfect for all countries and regions, and certainly it is not one size fits all solution. And each country have its culture and its background, its custom. But I believe the international cooperation is so important, so essential, is because we can learn from each other and then to combat this terrible pandemic. Thank you.
Thank you, Mr. Chen. We go now to Monsieur Thériault. Allez-y,
Mr. Thériault, go ahead, 6 minutes. Thank you, Mr. Chair. Thank you, Mr. Chen. Thank you, Mr. Chong. To welcome. Your countries are often cited as models of efficiency in fighting against this pandemic. With specific difficulties, and we too, we are close to one of the biggest hotbeds of this outbreak on the planet. And it was the same thing in Taiwan, with close to continental China. First of all, I would like to ask you this, Mr. Chen. You touched upon this earlier when you answered Mr. Van Bynen. You were one of the first to act systematically. You did not wait for all kinds of analysis from other organizations to implement measures. You are currently anticipating a second wave. Here we project that it might be in the fall. Now, there are lots of economic pressures, but how do you explain the fact that a second wave could come about? The impact of this forced deconfinement, does that have an impact on getting back into the economic recovery? Does the rhythm of deconfinement, does it necessarily have any impact on this sort of carefree attitude by the populations. And so this might have created some new outbreaks. What are you doing to fight against this? Just so we can draw some inspiration from your good practices in order to better face the next wave that might come here.
Yes, I think I would not say that Korea is perfect. I think we tried. I think we actually used the collective wisdom from people of different I think the practices. So we can actually come up with I think the most practical solutions to problems I think that you are concerned about. So what is the impact of this confinement? Staying at home and then staying where I think you usually do not wish to spend the whole day. I think it has a lot of impact on I think the mental and physical health of individual and then family and interactions among a lot of people. So we are concerned about it. So I think this is why I think we are also trying to have this sort of dynamic distancing. And then rather than this complete social distancing, I think to be granted. So with this dynamic distancing, you allow certain level of I think the relaxation when it comes to the small gathering and working at the office, and also you are spending some time in the public places and things like that. But again, when you do relax, you certainly should be anticipating. I think this epidemic might be coming back. So I think that's the sort of I think a trade-off that you need to be concerned about. Again, this goes back to my earlier point. Do you have a system in place to deal with it? When you know that I think the surge in cases are going to actually haunt you. If you are ready, you can handle it, and you can keep the sort of balance between economic revitalization and also the sort of I think the dynamic distancing. And I think you mentioned about this second wave. What is meant by the second wave? I think people have different opinions. In my personal opinion, and also this is based on the collective wisdom that we are actually putting together between Canada and then Korea, other scholars, and then best practitioners. I think the second wave, if it is coming, actually it is also up to what we are going to do with it. It is not just coming as a second wave. It actually depends on your behavior, your community, I think, actions, your government actions. If you have all these tools in place, you do not necessarily need to have the second wave in your country. And that is actually my opinion. And I think in the case of Korea, we have less than I think the 50 cases per day these days. But in Korea, Korean people are very concerned about even that small number of the cases every day. And we try to keep this under 20 and then in across the Korea. And that's the sort of I think the mentality here in Korea. And I'm with them. I'm an American actually by my legal status. So I know what they are thinking about.
Mr.
Actually,
Thank you, Mr. Chen. Thank you, Mr. Chen.
Merci beaucoup. Yeah.
Mr. Chen.
Thank you, Mr. Chen. You spoke so rightly about the level of international collaboration. What's happening at the level of research with your researchers, your scientists, in terms of international collaboration? Are you in constant link? I imagine that this issue with the WHO, the World Health Organization, did not allow you to take part in the Solidarity clinical trials. Could you talk to us a little bit about that? Are you part of that project? Do you fear that this could have an impact on your capacity or your ability to participate or to have access to future treatments or vaccines? What's the level of scientific research in terms of your ties with the international community?
Yes, I think that's very important point that I think you just brought up. So actually, between Korea and Canada, we are actually creating sort of this, AI and data
J'adressais ma
science
question à M.
partnership.
Chen. Excusez.
Mr. Chen, sorry, Mr. Chen. My question was meant for Mr. Chen. Yes, because I have very little time left. Sorry.
I love to share Taiwan's experience. Taiwan's experience is unique, and even we are not included in the WHO, but we have a lot of cooperation and try to reach out to work with our like-minded countries, particularly those countries with a democratic institution, and make sure that we can get the necessary in-time information. And they also, sir, you mentioned about the research development of those vaccine or medicine or testing kits. And also that is a teamwork with international health community as well. And our collaboration, particularly with this country, we not only share our PPEs, but we also try to facilitate the private sector, both in Canada and Taiwan. They work together and try to establish the PPE supply chain in this country. So I think a cooperation is everywhere. And then we try to find every avenue to work with our friends. And in this country, Canada, and we have a challenge for this pandemic. So we try to find the workable solution, try to tackle the issues. And I always say that no one should be excluded from the WHO, because the virus could be transmit from one area to another countries. And then we have to work together as a team. And it's so important. And that's the reason why we think we are on the right side of the history, and then we are do the right thing. And then we have good friends to continue to support us.
Merci, Monsieur Thériault.
Thank you, Mr. Thériault.
We go now to Mr. Davies. Mr. Davies, please go ahead. 6 minutes.
Thank you, Mr. Chair, and thank you to both witnesses for being here. Mr. Chen, when did the Taiwanese government recommend that its citizens wear masks? And on what evidence did it make that recommendation?
I think there is a lot of debate on the issues, whether or not and on what stage people should wear masks to protect themselves. And I think everything is really depends on the science-based evidence, and then also the experts' advice. For instance, myself, my family, and my colleague, we
Mr.
follow
Chen,
the guidance.
If I can just interrupt, my question was when did the Taiwanese government recommend that its citizens wear masks? When was it? When did that happen?
I think in the very beginning, in the early part of the January, people have a sense of the to wear mask to protect themselves. So we do it, as I always say, we do it on the very early stage, and it's a lot of debate, as I said, that even in these countries, and I think our custom and our culture help us to convince the people to wear the mask. And certainly that help us to well prepare. And another one challenge people didn't really touch upon is that how could you possibly to provide that many masks, particularly we're talking about the healthcare workers, the frontline workers, and even police, firefighter. They are in the public place. They urgently need the face mask. So people, stay 8 hours at home. They probably don't need that urgent for the face mask. So and I think the government in Taiwan in the early stage on daily basis we only produce 2 million masks, and certainly we have a 24 million population.
Mr. Chen, I'm sorry to interrupt. I have limited time.
I
will be asking about your mask production, but I want to turn to Mr. Chun and ask you, Mr. Chun, when did the government of South Korea recommend that its citizens wear masks?
I recollect that was as early as the early February. So that was the time that I think we had only a few cases across the country. I would say less than 30. But I think it was based on some evidence, and especially
and on what basis did the government of South Korea make that recommendation?
Okay, this was based on this potential, the risk of the asymptomatic, the cases of this epidemic. So when you do not know, who is infected when they do not show any symptoms, then I think you got to wear masks so you can prevent yourself, or you can actually protect yourself from this asymptomatic, the infection.
And do you think that the early adoption of wearing masks played a role in keeping the transmission rate so low in South Korea?
Yes, I think that is one of that was one of the best mechanisms. And as I mentioned earlier, this was the personal level non-pharmaceutical intervention using face masks and also this the washing hands, that hygiene. Those two were very critical to the entire process of a non-pharmaceutical intervention, and we made it sort of very mandatory. So even today, you find almost everyone is actually wearing face masks when you come to Korea.
Thank you. Now back to Mr. Chen in Taiwan. I know that Taiwan was an importer of surgical masks before COVID-19. You created an onshore mask production industry in just a month after registering your first infections. And I know that's grown into a daily capacity of 20 million pieces as of May. And that initiative was led by the government of Taiwan. Could you outline to this committee how the government of Taiwan was able to ramp up mask production so rapidly in response to COVID-19 pandemic?
I just mentioned the legislation is extremely important. After the 2003, that we already passed the law, and so that's the reason why we can have the CECC in the very beginning on early stage, because that's follow the rule of law, and in the legislation in place and the mechanism following up, certainly we can rally and try to the support of the private sector. And I think the society in Taiwan also, they have the honor and to try to help the society and its citizen. And that's the reason why I think we are in very short weeks, and we can rapidly to mass produce face masks from daily production of 2 million to up to today 20 million. And not only supply us people's need, and then also can help to try to ship to international society to help our friends. And you ask about the question about whether or not it's effective to prevent the spread of the virus for the face masks. I'm not the medical expert, but I think in the society of Taiwan, it's people's consensus that not only protect ourselves, but also we try to protect our friends and our family members. So up to today, even it's a very limited number of the confirmed cases, but in public gathering and then in the in indoors, for instance, the substation, and even it's you got this very spacious, but people wear masks, and then not only protect themselves, but also protect the others. So that's very important. I think particularly in country in Taiwan, we feel we have the obligation to do that.
Thank you, Mr. Davies.
Thank you.
So that wraps up this panel. I'd like to thank both of our witnesses for so generously giving of your time to us. I'd like to particularly note that for Mr. Trun, who I believe is in Korea, it's 3 o'clock in the morning. So I really appreciate on behalf of the committee for that you're staying up late or getting up really early to be with us. Kamsahamnida. Mr. Chen Shensang, xie. And I hope we have a chance to speak with you both again at another time. Thank you very much. We will now suspend and bring in the next panel. Thank you very much, gentlemen.
Thank you.
Welcome back, everyone. Welcome to meeting number 30 of the House of Commons Standing Committee on Health. Pursuant to the order of reference of May 26, 2020, the committee is resuming its briefing on the Canadian response to the outbreak of the coronavirus. I will skip straight to the introduction of our witnesses. So we have from Global Affairs Canada, we have the Honorable Francois-Philippe Champagne, Minister of Foreign Affairs. We have Ms. Martha Morgan, Deputy Minister, Foreign Affairs. We have Ms. Heather Jeffrey, Assistant Deputy Minister, Assistant Deputy Minister, Consular, Security and Emergency Management. Minister, if you wish, you have time for a 10-minute statement. please go ahead.
Thank you, Mr. Chair, dear colleagues, honorable members. Thank you for the invitation to appear before your committee to speak about Canada's international response to COVID-19. We are living, without question, through a consequential, a once-in-a-generation moment. The scope and scale of this pandemic has tested every community, country, and international institution, and we have all been affected both personally and professionally. We will be sorting through the global health and socioeconomic ramifications of this crisis for some time to come. En effet,
Indeed, the consequences of this pandemic will push us to place more emphasis on health diplomacy and supply chain diplomacy and economic security diplomacy. No one can underestimate the importance of the impacts of this pandemic on
switch to English, or sorry, switch to French. If you could switch the interpretation channel to French as well.
Okay. Well, my speech is both in French and English, so it's going to be, we'll do the gymnastic.
We'll wait for you to switch back and forth, but
Okay.
it makes a big difference for interpretation. If you don't do that, the interpretation comes in at the same volume as the original, and nobody can quite understand. But please carry on. Thank you.
Mr. Chair, I will oblige. En effet,
So I'll go back to the start. Indeed, the consequences of this pandemic will push us to place greater emphasis on health diplomacy, on
both.
Thank you, Minister. Are you on the French channel for interpretation? On the bottom, there's an icon that says interpretation.
Je vais, or re-switched it.
Thank you. That'll work better. So please, sorry, carry on.
It's better, Chair?
Well, we'll know when you start to speak French.
Okay.
Indeed, the consequences of this pandemic will push us to place greater emphasis on health diplomacy, on supply chain diplomacy, and economic security diplomacy. No one can underestimate the significance of the impacts of this pandemic on the economy and cybersecurity and the rights of people, equality and inclusivity.
Now I cannot switch to English. We must also recognize that the pandemic has not occurred in a vacuum. Indeed, this crisis is exacerbating existing global trends, including geopolitical competition, rising protectionism, increased inequality, and challenges to democratic values. And here at home, this pandemic has forced the government to come up with solutions to problems of an unprecedented nature. At Foreign Affairs, the consular response has, of course, been the most visible and demanding one. Hundreds of staff at headquarters and our missions abroad were redeployed to deliver the largest and most complex peacetime repatriation of stranded Canadian travelers in our nation history. And while I speak today about the consular element of Canada's response, I also want to highlight more broadly Canada's leadership in shaping global responses to the COVID-19 pandemic on the diplomatic, trade, and international assistance fronts, as they are critical and will only become more important as we go forward.
So let me begin by mentioning the consular response. Some maybe forget that before COVID-19 became a pandemic, Global Affairs Canada had already, since the end of January, repatriated hundreds of Canadians from Wuhan and were lending a hand to hundreds others in Japan on board the cruise ship Diamond Princess. And things only got worse As the virus spread and as countries around the world, including Canada, imposed rigorous border controls, at some points we had to shut down airspace, our borders, airports, and even strict restrictions on movements of our Canadian travelers in countries around the world.
When the world press pause, we went in full gear. Here are just a few numbers which should give you an idea of the magnitude of efforts which we deployed to meet the needs of Canadians in distress. In March, our emergency watch and response center was fielding thousands of calls and emails a day. Early in the crisis, single day total peaks at over 5,800 calls and more than 9,000 messages. Staff from across headquarters were redeployed to help handle all these calls and emails. Our network of 178 missions abroad likewise shifted gears to provide critical on-the-ground support to Canadians. Ambassadors, trade commissioners, and development officers found themselves working alongside their consular colleagues, arranging flights, ground transportation, permission letters, quarantine exemption, and emergency loan. And by June, we had facilitated the safe return of over 48,000 Canadian travelers from 111 countries, including 42,000 on more than 400 flights and more than 6,000 that were at sea on board 197 ships. And I really want to take this time to congratulate and thank Heather Jeffrey, who's with us today, who has done marvelously as the Chief Consular Officer. This was consular crisis management at a level never seen before in our country. A real-time illustration of Canada's strong and broad people-to-people ties around the world, and a remarkable show of resilience by the Canadian Foreign Service. Parallèlement,
In parallel, and despite troubling signs of lack of action and solidarity at the international level, Canada played and still plays a frontline role in coordination and development of a global response through quick diplomatic and trade links. Our work is guided by the clear commitment of the Prime Minister to defeat this virus everywhere and coming out of this crisis even stronger as an international community. With these priorities, the Prime Minister, my fellow ministers, we have had discussions over the phone and through video conferencing with hundreds of our counterparts around the world.
Minister, there seems to be a problem with your sound. All we're getting now is static. Could we so Minister, could you try plugging your headset in again, please? And if you could speak a few words, just as.
Is it better now?
Yes, it is.
Let's try to give it another try. It's probably when I change from languages that it seems that the system is freezing for a few seconds. So I will try to.
Thank you.
I'll try to do my best, I guess.
Well, yeah, it's kind of an awkward thing to have to change in the middle of a talk, but it's kind of where we are with the technology at the moment.
No, I appreciate. Listen, we're doing our best. So if you allow me, Chair, I'll just continue, and if colleagues bear with me, then I can.
Let me start the meeting again. Okay, the meeting is now resumed. Minister, please carry on. Thank you.
Thank you, Chair. So since the onset of the pandemic, Minister Gould, Minister Ang, and I have issued 44 joint statements with international partners, in addition to working actively alongside other cabinet members to drive actions through forums like the G7, the G20, the UN, the World Bank, the IMF, the WTO, and the OECD. No fewer than 18 G7 and 12 G20 leader-level and ministerial meetings have been held since March, aimed at laying out guiding principles for concrete actions, including addressing high debt levels in developing countries. As part of these efforts, the Prime Minister has spearheaded two very important global initiatives. First, Canada co-hosted a pledging conference on vaccines and therapeutics alongside the EU and Japan, which raised $8 billion to better test, treat, and protect people and prevent further spread of the COVID-19 diseases around the world. Second, in partnership with the Jamaican Prime Minister Andrew Holness and the UN Secretary General Guterres, Prime Minister Trudeau convened a special UN high-level meeting to advance solutions to the economic crisis and development emergency which have been precipitated by the pandemic. For my part, I established a ministerial coordination COVID group at the very start of the pandemic. Wanted to make sure that we could discuss, we could coordinate, we could share best practice. And I've done that with colleagues from Australia, Germany, Indonesia, Italy, Morocco, Peru, Singapore, South Africa, Turkey, and the United Kingdom. The initial setup was a venue to coordinate our response to multiplying travel restrictions, but this forum has become a key channel for exchange on the multilateral response, where we discussed about trade and emergency measures, where we discussed about maintaining the famous air bridges, maintaining transit hubs, and ensuring that supply chains would remain open. These efforts have been complemented by Minister Ang's support for Canadian businesses, and during this extraordinary time of global uncertainty and tightening credit conditions. Minister Gould has also been at the forefront of international efforts on issues such as enabling the continued access to education during the pandemic, on global health, food security, and reducing the disproportionate impact that the pandemic is having on women and young girls around the world. By early April, our government had announced $160 million in funding to support tangible supports to fight the pandemic, from strengthening health system in vulnerable countries to food security, education, and combating disinformation. Mr. Chair, without global action, what started as a health crisis could easily turn into a food crisis, which would then lead to a humanitarian crisis in some parts of the world. With a crisis of this scope, and it is important for us to reflect on the global architecture we would like to promote and contribute for generations to come. The feature of the international system have served Canadians very well over the past 70 years, and we will continue to be fundamental to Canadian prosperity and security. Let me assure you that Canada will continue to play an active role in shaping this new era, as we have at other defining moments in the history. I will conclude my remarks by discussing two things that have recently been in the news. First is Canada's bid for a seat on the UN Security Council. While the result, Mr. Chair, we got on Wednesday was not what we had hoped for, we are proud of the campaign we conducted over the last 4 years, and I want to thank all the teams who have spent so much passion and energy to promote Canada around the world. For Canada, this campaign allowed us to renew and strengthen many of our bilateral relationships that will serve Canada well for years to come. We will continue to promote our values and our principles around the world to build a more peaceful, inclusive, and sustainable world. I want to take this opportunity to once again thank the many officials, Ambassador Blanchard, parliamentarians, and Canadians who worked so hard over so many years on this bid. You really made Canada proud. Finally, there's been recent coverage regarding mortgages on 2 apartments I own and rent abroad. I would like to take a moment to address this issue here with you today. In keeping with my obligation as a public office holder, both mortgages have been disclosed to the Conflict of Interest and Ethics Commissioner in place in the public registry since I first entered politics more than 4 years ago. Neither of these mortgages, nor any of my other liabilities, have ever had a bearing on my function as a public office holder. And to avoid any distractions, both have been repaid in full and refinanced with a Canadian bank. And the public registry will be updated accordingly. And with that, Mr. Chair, I apologize for the technical glitches. I will be more than happy to take questions.
Thank you very much, Minister. We will now start our questioning. It may well be that we have only time for one round. We have the Minister until the top of the hour. We'll do what we can. We may have to do a very shortened second round if that's possible, but I think we'll only get a first round. So we'll
I'm happy to stay as long as you want. Chair, you decide. I know there was some technical glitches, and I don't want to feel that colleagues don't have the time to ask questions. So whatever you decide, but I will oblige.
Well, that's very dangerous talk. You better bring in a pizza. We'll keep you for all night. Thank you very much. So we'll try and do 2 rounds then. Thank you very much, Minister, for obliging us. And we're all working through these technical issues. I think it's working very well, but we do have to make some adjustments accordingly. So we will start round 1. Is Mr. Jennis back? There he is. Mr. Jennis, you have 6 minutes. Please go ahead.
Well, thank you very much, Mr. Chair. And I was experiencing some technical difficulties myself, so I do want to just quickly confirm one piece of the minister's testimony. Minister, did you say that you have refinanced those mortgages now, so you no longer hold mortgages with the Bank of China? Did I hear that correctly?
Both mortgages have been repaid in full and have been refinanced with a Canadian bank, and the public disclosure will be reflecting. So I spoke to the Ethics Commissioner, and we're in the process of filing a new version that will reflect that.
Well, thank you very much, Minister, because many of your colleagues in the House had been saying that this was not a big deal, and I appreciate that there is now an understanding that that is an issue and that has been addressed, and this is something that, of course, we in the opposition were calling for. I do want to clarify, though, one element of the disclosure, and that is that you had a disclosure from March 30th of 2016. That disclosure referred to a mortgage singular. It didn't make reference to multiple mortgages on multiple properties. When I checked your disclosures earlier this year, may have been February or March, there was no reference to either mortgage on the website. And then there was a disclosure dated June the 4th, which lists those 2 mortgages. Did you have both mortgages for the entirety of your time as a minister?
Mr. Chair, I do have a copy of the disclosure of the 30th of mortgages, and just to correct the statement you made, Mr. Genius, the reason I did that is that I think Parliament has other things to do than focus on my apartments. So I did that. I've been forthcoming. I've been disclosing that since 2016 when I entered politics, and every year since then. But to avoid any distraction to you, the opposition, Parliament, and this committee, I decided to refinance with a Canadian bank.
Minister, I think it'd be worthwhile if you table before the committee that record of the March 30th disclosure from 2016. I'm surprised to hear you say that, because it's certainly not what I think others saw on the website. So maybe there was some information you gave to the ethics commissioner that was not publicly disclosed, or maybe I'm wrong.
Well,
but I think
I have it in front of me, Mr. Chair. Do you want me to read the record, because I have it in front of me?
Can you table the document, and then I got some other questions I do want to ask you as well.
For sure,
Minister.
Mr. Chair, I don't know how to table virtually, but I will make sure that it's sent to you in whatever fashion is needed.
Point of order, Mr. Chair. What has a mortgage got to do with COVID and Health Committee?
That seems like a point of debate. But I can respond on just on the point of order. The members should know well that the motion which allowed this committee to meet online gave the committee explicitly permission to go beyond the normal parameters for the Health Committee. Part of this is because the Canada-China Committee has not been allowed to meet, despite the majority of the members wanting to meet. The Foreign Affairs Committee has not been called, is not able to meet, and the minister wasn't in the House all of last week when I wanted to ask him questions about this right away. So just on Mr. Van Bynen's point of order, I think it is well within the parameters of the unanimous consent motion passed by the House. And I would love to be able to ask the minister more of these questions in the House, at the Canada-China Committee, but we've been deprived of those fora to ask those important questions.
Thank you, Mr. Dennis, on this point of order. I think we are getting into debate. We are engaged in a study on the government's response to the coronavirus. While you are correct that the motion does allow us to deal with other things, that is not the study we're undertaking now. But please carry on, and hopefully we'll get more to COVID-19 kinds of questions. Thank you.
Well, thank you, Mr. Chair. It's interesting that we have Liberals intervening because it's the Liberal chair of the Canada-China Committee that has refused to allow that committee to meet, even though a majority of members want that committee to meet. But I'm happy to continue with my questioning unless Mr. Davies wants to intervene here.
Only to make the point that in addition to what Mr. Genua said, I would note that the minister raised the issue of his mortgages in his opening statement.
Thank you to you both. We are getting to debate, and I certainly take your point, Mr. Davies. Please, let's carry on with questions.
Well, thank you very much. I have some other questions on important foreign policy matters I want to ask the minister. Minister, is it your view that Uyghur Muslims in Xinjiang in China are being subject to genocide at the moment?
Well, what I can say on behalf of as Foreign Minister of Canada, we're very concerned about human rights condition in China. I have raised that personally with my counterpart. The Prime Minister has done so, and we will continue to do so because human rights is a core pillar of our foreign policy.
It was a very specific question. Do you think there is evidence to suggest genocide is taking place in Xinjiang?
Mr. Dennis, I would urge you to relevance to our study is the government's response to the coronavirus, please.
Mr. Chair, I think Mr. Davies was quite on point in terms of the fact that I'm responding to things the minister said. I think our view of genocide is quite germane, for instance, to our engagement with the United Nations, and the minister referred to our Security Council bid. And I would ask you to to take a view that's consistent with the unanimous consent motion that the House passed in terms of what is and is not germane.
Mr. Dennis, we are engaged in a study on the government response to coronavirus. And that is what the minister is here to address. I really hope that you bring your questions to the government response to the coronavirus. The plight of the Uyghurs is very important, absolutely, but it's not the subject of our study. Thank you.
Does the minister want to address the genocide question, or should I move on to other points?
I will oblige with what the chair is directing Amir to testify.
Well, okay.
I'm at your disposal, Mr. Chair.
Well, okay, Minister, I would appreciate if you make yourself available to the Canada-China Committee as soon as possible. A majority of members of that committee want that committee to meet, but Mr. Regan, the Liberal chair, has consistently refused to abide by the majority of wishes of the committee. So I had to come find you here at the Health Committee because, frankly, that was the only place I could find you to ask you some of these critical questions.
Mr. Genius, you were welcome to come with me to New York. It's a matter of public record that I spent a week trying to work with our officials at the UN to win the UN Security Council seat.
It's also a matter of public record, Minister, that's why we have a virtual parliament. We have a mechanism by which you can answer questions anywhere. And on Thursday, the COVID committee sat, and you chose not to be available to answer questions on Thursday, even though the vote had already taken place for our Security Council bid.
Mr. Jonas,
let me ask you another question with respect to our relationship with China and with respect to the response of COVID. It it seems very important to me that we have an international investigation into the response of the international response to the COVID pandemic, but also the response specifically of the government of China, and that investigation involves the capacity to have investigation take place on the ground in China with unfettered access to Chinese experts. Are you supportive of having that kind of investigation taking place?
Well, Mr. Chair, I'm very happy to respond to Mr. Genius on that, because when the issue about an investigation of the WHO was first put forward, our Australian colleagues reached out to us. We've been front and center in the discussions around that. Like I said, I don't think it is wise to undermine the work of the World Health Organization at this time. They're doing important work in many parts of the world, and I've been talking to about 130 of my colleagues around the world, and they say that at this point of time, we need to work with the institution we have, but definitely there will be a time where we need to ask hard questions about the leadership, the financing, the mission, the alert system. And I can assure Mr. Genius that Canada is front and center in all these discussions, because colleagues around the world call us when these discussions are happening.
Yeah. Just, Minister, that wasn't my question. Again, my question was about the response of the government of China. Mr. Chair, you've been repeatedly interrupting my time, though. I think I have at least another minute, because there's been so much back and forth where you've been
Mr. Janice, I stopped the clock when you had when we were dealing with the points of order. Your time, you've a minute past your time. So thank you for your interventions. We will go now to Mr. Fisher. Mr. Fisher,
Chair, just before we do, because I don't want to interrupt Mr. Fisher, I do have a point of order that I do think would be helpful for future questioners. I agree with you generally that although I believe there's wide latitude for questioning before a committee, when the minister comes before a committee on COVID and spontaneously in his opening statements raises issues of Canada's rejection of a UN Security Council seat and his 2 mortgages, which neither of which have anything to do with the COVID-19 study, he has obviously waived his right to restrict questioning to COVID. A witness can't selectively decide which non-germane issues he wants to talk about and then restrict committee members from going into those. So just as a matter of policy, he's the Foreign Affairs Minister. He clearly has raised issues beyond the COVID-19 issue, and I think committee members should be free to explore issues as they see fit. And I think we should have that clarified before anybody goes further.
Thank you, Mr. Davies. Whether the minister speaks to these issues is not a matter of right to the minister. It's a matter of what is the committee studying. We need to be relevant to what we are studying. So the plight of the Uyghurs is not part. It was not part of the minister's statement. For example, whether the minister was present or not for the COVID committee is not relevant to our study. So I give very wide latitude for questioning, but I do think we need to stick to the subject matter of our inquiry, which is the government response to COVID-19. I accept that the minister did introduce these other matters, and I think that that's fair to respond to them. But I really hope that we can focus our interventions on the COVID-19 response.
I'd like to point of order as well. I'd like to concur with Mr. Davies that if he's going to bring up these other issues, we should not have people's questioning be constantly stopped when we are asking questions of a different matter.
Yeah, point of order as well, Mr. Chair. Point of order as well, just on that. Mr. Davies made his point. It sounds like you've made a ruling that you don't want to allow those kinds of questions to take place. And if that's the case, I'd like to move to challenge the chair on that, because I think we need to hear the view of the committee as to whether the minister should have to answer questions that respect his opening statement.
Well, I have not, in fact, made a ruling. I'm just encouraging the members to stay on topic.
But if I might, Mr. Chair, just very briefly, if the Minister of Foreign Affairs raises Canada's the rejection of Canada's application, bid for a UN Security Council seat, then I think he's left it wide open to explore what the reasons for that might be.
I've already granted that point. Thank you. and as he did mention in his statement, so fair enough. But let's try to bring it back to COVID-19. If you want to address matters brought up in his speech, by all means, but let's really try to focus on COVID-19. Thank you.
So, Mr. Chair, just on my point of order, it sounds like you're either making a ruling which is subject to a challenge, or you're not making a ruling. You're just making a friendly recommendation. So, if it's just a friendly recommendation, then members are welcome to proceed and ask whatever questions they want. If you're making a ruling, then I'd like to proceed with the challenge.
As I said, I have not made a ruling, but it is certainly an encouragement.
Thank you.
Off topic, I will try to bring people back to the topic. But thank you, and let us continue with Mr. Fisher. Mr. Fisher, you have 6 minutes.
Thank you very much, Mr. Chair, and Minister, welcome to you and your team. I think I can speak for every MP on this committee and all the MPs in the House of Commons that we had so many constituents that were stranded all over the world due to the pandemic. And I can speak for Dartmouth Cole Harbour, we had young firefighters in Peru, we had seniors struggling aboard the MS Zandam. And I think, again, we can all agree that it was a very challenging few months. Back home, we had families that were rightly very scared, nervous for their loved ones, and the borders were closing, airlines were shutting down, and it was a scary time. I want to take a moment to thank Global Affairs staff, consular staff, your team. Specifically, I want to thank your Parliamentary Secretary, Rob Oliphant, and his team. Our office, much like the other 337 MPs, were inundated with these calls and these requests from these frantic parents and constituents. And what your group managed to do was absolutely incredible. I also want to thank my constituency staff for the work that they did, basically working through home. It was absolutely incredible. I'd like to ask you, thinking about just how difficult this process was and this all hands on board, all hands on deck, what was it like negotiating safe passage and eventual disembarking of passengers and getting these Canadians from dozens and dozens and dozens of countries from around the world, getting them home? Tell us a little bit about some of the challenges that you and your amazing team encountered.
Well, thank you, Mr. Fisher, for that. I think it reflects on the team. This was a team effort like we've never seen before. As I said in my opening statement, this was the largest repatriation effort in Canada's history in peacetime. Never we thought that we would experience border closure, airport closure, airspace closure, martial law being imposed in a number of countries where we needed to bring people in. You're right, there was at the very beginning, I just want to give a number that will make you reflect on that. Since March 13, we received 104,000 calls and 200,000 emails. Just to give you a sense of perspective about the scope and magnitude of what we've done. And I think there's a lot of lessons learned. I think we'll have to reflect how we operate, what's the role of honorary consul, how we have been able to do that. I must say that Heather Jeffrey, which is here, and my deputy, Mr. and Mrs. Morgan, have been extraordinary. We've done things like we've never did before. We did diplomacy by text message. I managed to get people out of Peru by texting my counterpart there and negotiating lending rights. We got people out of Morocco by texting the minister and saying we need one more flights. When I created the COVID ministerial group, was really, in effect, to try to tackle together those challenges. That's why I invited Morocco, in particular, and Peru to join our group, because the European Union, us, and many countries around the world were finding the same struggle. But again, I want to say thanks to the frontline people, to our embassy staff. Everyone became a consular officer. We turned this around, and I'm extremely proud of the work. We had 600 people at time in our operations center. This has been truly extraordinary, and just shows that when we want, we're able to do big things together. And all the merit and credit goes to the frontline people who spend countless hours helping other Canadians.
Well, thank them for me, if you would, please. The numbers suggest that the measures we've got in place in Canada are working, and of course, we're not out of the woods yet. But people are starting to talk about international travel, and we had airlines on yesterday. I'm starting to think about business and pleasure travel again. I'm interested in your views on when that might be appropriate and what that kind of travel might look like in a post-COVID-19 world, or in a potential second wave, or perhaps we're always going to be in a COVID-19 world.
And thank you for that question, Mr. Fisher. And thank you for the works of all the parliamentarians. To go back to your earlier question, this was really Team Canada. I received as many questions from all sides of the House. We have helped all MPs. I think at some stage I was receiving 600 messages a day from MPs who were asking us to intervene to help their constituents. And I must say, this was probably one of the proudest moments that us as parliamentarians, we came together to help Canadians. To your question about travel, I am in touch not later than yesterday with my German counterpart. I've been talking to the High Representative for Foreign Affairs of the EU, Josep Borrell, which is my colleague. We've been talking many times about what, for example, the EU is doing with respect to reopening border. Obviously, when it comes to us, our geography here requires us to take measures to protect the health and safety of Canadians. That's obviously paramount. But we're looking what others are doing. We've been in touch, as you know, with our US counterpart. We're in touch with our European counterparts. We're looking at some of the best practices that have been put, for example, in the Nordic country, in the Baltics, to see what other measures, others have been taking. I'm in touch also with the airline. I understand that for them, resuming international travel is important. So we're trying to balance all that. And I can assure you that first and foremost is the health and safety of Canadians, making sure we have all the processes in place and looking at the gradual reopening when the time comes. But this is a very live discussion between foreign ministers around the world.
Well, Minister, my time is up. I do wish you a very happy birthday this Thursday, your 50th birthday. I hope you get a chance to get a little bit of downtime. Thank you so much.
Thank you, my friend. Thank you.
Thank you, Mr. Fisher. We go now to Monsieur Thériault. Monsieur Thériault.
Mr. Thériault, go ahead. 6 minutes. Thank you, Mr. Chair.
French I master pretty well, so I want to get it in French, but my system is a bit slower. Merci.
Absolutely. I think your French is coming.
Yes, Mr. Thériault, sorry, go ahead. Well, I think the chair will take note of that, remove that from my time. Now, to follow up on Mr. Fisher, it was quite a colossal job. I think it was right to thank the team from his writing office, and I will also do the same thing, because I had a little press scrum in January, February, where I said that we should be better informed. The 360 MPs, information officers, we must play a role in helping people to go through this, and this has been done in all the 338 ridings, and it's a massive job, but nothing is perfect. We made some mistakes along the way. We're here to find solutions so we don't repeat the same mistakes, and we should avoid complacency, because it's because of complacency that sometimes we are not able to take up some of these major challenges, and we know there are more that will appear in the future. So I have about 3-4 questions that are very specific, and I think that's why people are still finding responses, so answers to these questions. The first question relates to cost for Quebec and Canadian families. Those that travel to Africa, for example, were not able to be repatriated except at very high cost. Some even had to buy tickets of $5,000. In India, it was $3,500. A 4-person family, it's $14,000, and for Africa, $20,000. So these citizens are faced with Hobson's choice. They either become highly indebted and it could mortgage their futures. There is no work. We are just starting to get back into work, and for several years they will be stuck with these debts. So they're being asked to make a choice between their health and indebtedness. I know I spoke with Remedian from somebody in India. He said the United States gave them funds, a credit on that person's name, and the state worked towards having a monetary agreement. Why didn't we copy that? Why didn't we remove this entire load that was placed on families? First of all, Mr. Therio, thank you for your question. I would like to emphasize the work of Mr. Bergeron, Madame Aslav. During the pandemic, we had weekly calls to try to face the issues progressively, as you mentioned. In terms of the cost, as you mentioned, it's a significant issue. Right from the start, we expected this question. You know, an emergency repatriation in most cases, in most countries, the airlines that worked with Canada could not take passengers on board. You mentioned India, you mentioned some African countries. So ticket cost was a return ticket. These were return ticket cost. I personally negotiated with Qatar Airways. I discussed with Ethiopian Airlines, people that greatly assisted us to repatriate people at the best cost. And the Canadian government, under the circumstances, I must stress that under the circumstances, the whole world was trying to bring people back home. There were some exceptional conditions, even just finding transport companies. That's why we put about $7,000 in place. And I think it's roughly what the Americans did. Most of the countries did this on a cost recovery basis because the volume was beyond what we had seen even in similar cases in the past. Some gave credit, but others did it on a reimbursement basis. Well, people have to be able to refund those monies. There are economic difficulties. People that couldn't do this were obliged to stay. They had a right to those loans. If I look at my sheet here, we had 4,100 loans, about $14 million. People could borrow up to $5,000 for their basic needs, so to buy a plane ticket. So I agree that we can always bring about improvements. That's why we raised these issues. But in times of emergencies, if I look at the number of loans, over 4,000 loans granted, we were able to assist people in over 110 countries. I think it's an unprecedented operation, and with the cooperation of Air Canada, Air Transat, Subwings, WestJet, and even foreign airlines, that's how we were able to take up some of these challenges, bringing the equipment, the planes. It seems easy, but it's getting people on board. That's hard. Yes, especially when some embassies are not answering emails or phone calls. Monsieur Jiang said he received emails from Germany, from other embassies, from the United Kingdom, but there was no response. So something isn't working right there either. Several citizens are still caught up abroad right now. That's what really matters. And they have seen their travel insurance expire over the time of this crisis, and it's impossible to renew. So what will you do? What do you plan to do to compensate them for the costs incurred that are potentially quite exorbitant for some? Mr. Therio, from the start, we said despite all the efforts we could make, there would be people that cannot be repatriated. We have repatriated over 48,000 Canadians, and it includes people who came back through normal commercial flights. There are still people in some countries we are trying to repatriate, and we are working with our allies. I'm talking about travel insurance here. There are people that are still out there in the world and that have not been able to come back.
Thank you.
N'hésitez pas à m'appeler, monsieur.
Mr. Therio, you can always call me and I'll be pleased to provide you some answers. Thank you, Mr. Therio. So let's go to Mr. Davis.
We go now to Mr. Davies. Mr. Davies, 6 minutes, please.
Thank you, and thank you, Minister, for making time for the committee. I hadn't planned on asking you a question about this, but you raised it, so I will ask you one question, Mr. Minister. The optics of a foreign affairs minister having mortgages held by a state bank of a country with which he has to engage in diplomatic relations it raises some questions. Do you acknowledge that the optics of that were problematic?
Well, Mr. Chair, at all time I've disclosed that since I entered politics. I took a mortgage many years ago with a bank in London. That's what I've disclosed, and I've been transparent all along. And like I said, to avoid any distractions, because we're in the middle of a crisis, I think parliamentarians have better things to do. So I've repaid in full, remortgaged with a Canadian bank. And I did not, and I feel very transparent because as a lawyer, I take my ethical responsibility very carefully. I read the spirit and the law and the letter of the law, and at all times I've disclosed that. And like I said, for the record, this is a bank in London with branches in London that was contracted many years ago. Many years while I was not in politics, and since then that I've been disclosing every year since I've been entering Parliament.
Thank you. To be clear, I raise no aspersions about it. Yes.
Mr. Davies, we're having trouble with your sound. Could you
sure.
Maybe
Thank you. I'll try that.
Thank you.
Thank you. Thank you, Mr. Minister. And I cast no aspersions about your transparency. It's just the optics I was curious about. Minister, on April 10th, 2020, Global Affairs Canada issued an official statement in support of UN Secretary General's March 23rd call for a global ceasefire amid the COVID-19 pandemic. Now, the day before, however, the department had announced that it was lifting a moratorium on arms export permits to Saudi Arabia. And of course, that moratorium had been issued after the brutal assassination of Washington Post columnist Jamal Khashoggi, described by the UN Special Rapporteur on extrajudicial summary or arbitrary killings as a, quote, premeditated extrajudicial execution.
Monsieur le Président, il n'y a pas de traduction.
Depuis
le début.
Mr. Davies, we're having trouble with the sound. We're not getting translation. Can you? It sounds to me actually like network bandwidth. Are you able to free up your network a little bit?
It's the same. It's what I've been using all morning, Mr. Chair. Maybe I was speaking a bit quickly. If I could make sure I have my time allotted, I'll just finish the question. To finish my question, Minister, for which the state of Saudi Arabia is responsible, why did your government choose to lift this moratorium in the midst of a public health crisis?
Well, Mr. Speaker, as you know, when I came in this job, we did a couple of things. One of the things, as you know, the Minister of Finance, because I'm sure you're referring to the GDLS contract, the Minister of Finance renegotiated a contract which we inherited, which is largely completed, more than 50% already completed, to improve the terms and conditions to allow disclosure, because I believe that Canadians are entitled to know that the government of Canada was on the hook for multi-billion dollars. At the same time, I appointed a panel of experts to guide future foreign ministers in their decision when it comes to that. We have been a party now to the ATA, and it is my duty and my role and my firm belief that we need to do everything we can to uphold, obviously, the spirit of the ATA. We have an expert panel, and we are going to be, and we're working with our international partners now to create an inspection regime to make sure that when we do make these decisions, we have the best possible advice, that we consult widely, and that we both respect the spirit and the law that is under the ATA, and it's now Canadian law. So I would say, Mr. Davis, you can criticize the action, but what I've said is we're going to look on a case-by-case basis, and I would refer you to the number of permits that I've approved, and you will see that all of those have been within the constraint of Canadian law and the spirit of the ATA.
Yes, it's the political office,
Mr. Davies,
yes.
Again, we're having trouble with translation with you. Could you be very, very, I'm not sure how to fix this. It really sounds like bandwidth, but if you could speak extra slowly and
Okay, I'll try to speak slower. How's that?
Thank you,
Mr. Minister. It's what I'm asking you about, though, is on the one hand, one day Canada says they support the UN's call for a global ceasefire, and at the same time, you end a moratorium that then permits military vehicles to be exported to Saudi Arabia, which a UN panel has found to commit widespread and systematic targeting of civilians, acts that constitute war crimes. Do you not see, sir, the contradiction there?
Well, I would say we've been transparent with Canadians because 3 days or 4 days before, I think it was on March 31st, the amended contract was signed. And I think it was only appropriate in my duty as foreign minister to come to Canadians before to be fully transparent about what the Minister of Finance had renegotiated in terms of the contract with GDLS. And on the other end, what kind of measures that I was putting in place to uphold the spirit and the letter of the law as Canada has signed the ATA, talking about the expert panel that I've put and also what we're going to do for an inspection regime. So if you look at the timing, Mr. Davis, just look at the date the contract was amended. And I did that few days after, before permits were obviously issued with respect to that contract.
If I can switch to another subject, the government of Costa Rica has proposed that the World Health Organization set up a global pooling mechanism of intellectual property rights, research and data on COVID-19 related technologies. This is to ensure open innovation and support the production of COVID-19 technology that will be open to all countries of the world. Has the government of Canada made a public statement in support of that initiative, or what is your position on it, Mr. Minister?
Well, thank you for that very important question, Mr. Davies. That the fact that a vaccine should be a public good is something that has been talked around the world, and that's something that Canadians support and Canada support. I think even the Prime Minister spoke about it. But certainly we realize that unless we care for the most vulnerable in the world, as long as the virus is somewhere, we're all going to be at risk. And Canada has been at the forefront of the efforts. I mean, you may recall in my opening statement, I've been the one who said we need to amplify the voice of the most vulnerable to make sure that what started as a health crisis doesn't turn into a food crisis, which is likely or may happen in some parts of the world, and that would lead to humanitarian crisis. So everything we can, as you may have seen the amounts that we have said when we were at the Gavi pledging conference, the amounts that we've put forward to strengthen the healthcare system in many countries. I certainly believe that this is a time for Canada to care not only for our country, but also to show leadership around the world when it comes to the COVID crisis.
Thank you, Mr. Davies.
Thank you.
Thank you, sir.
That wraps up round one. So we do have a hard cap on our access to these facilities, these virtual video conferencing facilities at half past the hour. So I think we'll have to do a somewhat abbreviated second round. So instead of 5 minutes, we'll do 4-minute questions. And for Mr. Davies and Mr. Desilets, I believe, there'll be 2 minutes. Thank you for helping out. And with that, we will start our second round with Dr. Kitchen. Dr. Kitchen, please go ahead, 4 minutes.
Thank you, Minister, for staying and allowing us to have this second round.
Sure.
Minister, I'm going to follow up a little bit on what Mr. Terrio's one of Mr. Terrio's question was. And GAC has always had a mechanism for loaning money to Canadians who are stuck abroad and find themselves in financial distress, with a requirement that those loans be paid back to the government within 30 days of receiving an invoice. According to the Global Affairs website, for frequently asked questions on the emergency loans for COVID-19, the question and answer is as follows. Question: I have returned safely to Canada. How do I repay the loan? Government's answer: Global Affairs Canada is establishing the repayment process and will provide more information soon. It is not possible for you to pay back the loan at this time. Mr. Minister, I mean, when are they going to have to repay the process, and when will it be established?
Well, first of all, I'd like to say thank you for that question. I will certainly look into that, but I think maybe Mrs. Jeffrey can comment on that. I'm not aware of necessarily of the question and answer on the website of Global Affairs Canada, but I'm sure we can provide elements of response, and either the deputy or maybe Ms. Jeffrey can provide you elements of response. Obviously, we want people to repay, but to your specific question, why the Q&A says that, I'd have to defer to our officials on that.
Then I would ask if the official could send that to us in writing afterwards. I'd appreciate that.
Sure.
Because there are more questions. You also mentioned that people basically are entitled to the money to fly back, and therefore they should be able to get that money because they need that money to pay for a flight to get back. Most of these Canadians have flown outside the country and have got basically a return flight there. So my question to you is, who gets the return flight refund once they apply for it?
Well, that's a private matter between the traveler and whatever travel company they have or airline.
But GAC is paid for an extra flight. Therefore, the government of Canada has paid for this extra flight. Why is it that government of Canada is not expecting someone to refund that flight?
Just for the record, sir, we've never paid for any flight. Citizens who were embarking on all our flights were responsible to pay for the fares. What the government of Canada did was to offer a loan because we had some Canadians who were in distress in some parts of the world. But this has been done on a cost recovery basis. And I can give you the exact amount of what we have expended so far because, we had an appropriation to repatriate Canadian. And so far we have invested only $8.5 million on flight facilitation because what we were doing, we were providing a certain minimum guarantee.
You just said you didn't pay for flights. So
no,
anyway, I'll move on.
But there were other
Mr. Minister, I thank you. On May 27th, a representative from the Red Cross appeared at this committee. When asked about the support Canada has provided to other countries in terms of supplies, he stated, "We are also in partnership with Global Affairs Canada in supporting the shipping and receiving of international donations and protective equipment." Can you tell us how many donations has Canada received to date?
Well, I know we received donations from China and Taiwan, but I'm sure that we receive help from many, many countries. I can tell you, sir, that we would not have been able to repatriate thousands and thousands of Canadians if countries around the world were not facilitating. Some countries have allowed Canadians to fly on their plane. Some other have opened their airspace. Some other have granted facility, extended visa. So I would say we need to thank a lot of people who have helped our Canadians.
We are talking about PPE here, and I'm basically questioning what sort of PPE items have been donated, either through the Red Cross or through any other channel.
Well, I would have to defer if you want the exact. I suspect that the thing we received, the thing that Canada needed most was masks, was PPE, was hand sanitizers. I think we received. You're right. We work with the Red Cross because that's the best way we could do that. But if you want an exact account, I'm sure the officials can get back to you, sir, and provide you the exact breakdown of what we have received.
Thank you
very much. The Red Cross also went on to say that with respect to the procedures of procurement of PPE. Yes.
Your time is up. Thank you.
Oh, thank you.
Thank you. We go now to Dr. Jaczek. Dr. Jaczek, please go ahead. 4 minutes.
Thank you, Chair, and I will be sharing my time with Ms. Sadu. First of all, I do want to thank the team at Foreign Affairs for all the incredible efforts you've made on repatriation. My constituents are incredibly grateful, and I think all Canadians have now become very aware of the consular service. And those of us who've traveled abroad have often seen the advice to register with the consular service, and now we know why. So a real heartfelt thank you. And a special shout out to Ms. Morgan. A year ago, you and I were in the same ICD class at Rotman, and I don't think we ever thought we would meet like this at that time. Now, my question specifically relates to some of the international assistance that the government has provided, and Minister Karina Gould's made a number of announcements, $50 million in international assistance to the World Health Organization, other partners for potential bilateral support for developing countries in response to COVID-19, and actually the list is very lengthy. Earlier today, one of our witnesses did express a certain amount of concern that donations that went from Canada or from any country to the UN took quite a bit of time to actually meet, to actually get to the frontline services that they were designed to support.
Okay.
And I'm wondering if Canada has a way of vetting whether the aid goes to where we want it to go.
Well, thank you first for your kind words, and I really want to transfer that, and I'm happy that Deputy Minister Morgan is there to pass on the good words you've said to the whole of the team. They really did hold of the work, and the MPs have been very helpful. To your point about the aid, we can certainly look into that. We have tried to work with a number of multilateral partners, whether it's in Africa, the Caribbean, the Pacific Island. As you know, the best way to deliver some of this aid is through local agency. We work with the Atomic Energy Agency, for example, to provide some test kits in the Caribbeans. We work with PAHO, PAHO to provide some health equipment in other parts of the world. So we've been engaging with partners around the world. I think other colleagues mentioned the Red Cross. We've been engaging with those which we think with our experts are the best way to deliver. And I want to make sure, like you said, that the aid is going to where it is. But having talked to foreign ministers, like I said, in about probably 130 countries now in the last few weeks, you know, all of them, or I've not heard that someone would have suggested that the aid did not go through where it's supposed to be. But we certainly can look into that further. But I would say what matter, and nothing is perfect, as you know, when you're dealing with a crisis. I think some colleagues have highlighted ways that we can improve, and we certainly look into that as to best practices and how others have done. And we'll have to do a postmortem about everything we did in order to see how can we best prepare ourselves for the next crisis. But certainly, I think we've worked with a reputable international agency, and we're happy to look into any case that may come to light if other witnesses have identified shortcomings. I am more than happy to take that with our officials and to see what may have happened.
Ms. Sidhu?
Thank you for joining us, Minister. I want to echo my colleagues. I want to say thank you to you and all the Global Fair team for the historic efforts for bringing thousands of Canadians back home. And you heard when you joined virtually Brampton Town Hall. Minister, my question is about Canada's global role in responding to the crisis. What has been achieved so far in working with our partners around the world in fighting COVID-19, particularly when it comes to vaccine research? How do you see these relationships moving forward now?
Well, I would say I think during this crisis, Canada has shown its best leadership in times of crisis is what people will remember. The Prime Minister, for example, when he participated in the gathering at the UN and the other pledging conference about Gavi, it just shows that when the EU and Japan asked Canada to be there, that just shows about the place of Canada in the world and the role we can play in the influence. So I think we're going to build on that. We have built a relationship. You know, the foreign minister COVID meeting that I referred to in my opening statement is just but one example where we led, because we realized that we needed more coordination, learn from each other, look ahead. And I must say I'm pretty proud that we had our 9th call. I mean, it's not, if you look back in the history of Canada, it's not really common that Canada would be talking almost on a weekly basis with countries like South Korea, Singapore, South Africa, Brazil, trying to make sure that we take into account what's going on, how can we work together, talking about the air bridges, the supply chains, the transit hubs. So we've been trying to make a difference in very concrete ways for people, because at the end, a Canadian expected us to rise to the challenge, and I'm happy to say with members that we've been able to work together in a way that I think shines a very nice light on the work that parliamentarians can do when they work together.
Thank you, Ms. Sidhu. We go now to Mr. Jennis. Mr. Jennis, please go ahead, 4 minutes.
Just a point of order, Mr. Chair, before I start, 4 minutes or 5?
4 minutes. We have to cut this short. We have a fairly hard stop at 1/2 the hour.
Okay, well, Mr. Chair, I'm disappointed after your repeated interruptions to hear that this isn't the regular allotted time. If I can ask the minister, you know, as far as it pertains to COVID-19, you know, I think one of the core foreign policy issues here is that we had the outbreak of a novel virus in China, where there was a state-enforced cover-up that included the intentional suppression of discussion of the virus on social media. Do you agree with that assessment?
Well, I'm very concerned about disinformation. I think I've said that at the beginning. I think we have seen some state and non-state actor which would try to influence public opinion to disinformation. I can assure you, Mr. Genius, that's something that we're talking at the Five Eyes. We've talked at the G7. We're talking with a number of foreign ministers, very aware of what some state and non-state actors are trying to portray in this crisis, and we're engaging with eyes wide open.
Sorry, Minister, just because of the limited time, if I can sharpen that question a bit. I mean, what do you think of the government of China's response in the early days? Because we're not talking about combating disinformation. We're talking about a system of tracking and eliminating any comments from Chinese social media, raising concern about the emergence of a new virus. Well, and that's why we have a pandemic, because the Chinese state was suppressing discussion, which could have facilitated an earlier response.
I think, you're right that questions will have to be asked. I mean, that's part of the review that we have supported the World Health Organization, for example, to say that tough questions will have to be asked. And I don't want to prejudge the conclusion, but I can assure you that we've been front and center in the discussions with our Five Eyes partner, with G7 countries, with Australia, to look at how we can improve the system, the alert system, the leadership, the financing of the organizations that we need to prevent the next crisis.
Minister, I didn't really get an answer to my last question, which was you're talking about the international investigation. I'm asking about the initial domestic response by the Chinese government, which I think was, not critically analyzed or criticized by the World Health Organization to the extent it should have. But, does the investigation need to include a look at the Chinese state's own domestic response and in particular suppression of information about the virus?
Well, I would say that countries around the world want to get answers to a number of questions. I don't want to prejudge what the scope of the review will be necessarily, but I think you're quite right that the questions need to be asked. I've been forthcoming. I've been saying that from day one. I've been saying that in private and in public, that tough questions will have to be asked, and Canadians and the international community deserve answers. This is a global pandemic. It's affecting everyone. It's affecting our way of life. And therefore, we have been supportive from the get-go. I can assure you, because you may not be there, but I can assure you that when these discussions were happening, Canada was there, and certainly we supported an investigation, an inquiry to make sure that the light would be shed on all of that.
Thank you, Minister, and I'm aware of what the specific text of the World Health Assembly resolution was. I want to move on to something else. I had asked about the situation in Xinjiang, and I want to just further probe that point a little bit because you didn't answer the genocide question specifically, but I'd like to know if the government is contemplating the imposition of Magnitsky sanctions against those involved in gross violations of human rights in Hong Kong, in Xinjiang, or anywhere else in the People's Republic of China.
Well, I can say, I told you before, Mr. Genius, human rights, whether it's in Xinjiang or whether it's in Hong Kong, you've heard me speak pretty loud when it comes to Hong Kong. We had 3 statements. One, the first was with the U.S. No, the first one was Australia and the UK.
Can you please address the issue of Magnitsky sanctions? It was a specific question. We're going to run out of time. Is the government contemplating the use of Magnitsky sanctions against gross violators of human rights in China? Yes or no?
Well, I told Mr. Gene, if you want me to answer, I'd say we are at the forefront of the defense of human rights around the world. That includes in China, that includes in Hong Kong.
Yes or no?
We will continue to defend human rights wherever around the world. And I thank you for raising. No, but I thank you for asking these questions and raising that because we're on the same page.
Are you contemplating the use of Magnitsky sanctions? Yes or no?
Mr. Jennis, thank you. Your time is up. We go now to
the record is clear, I think. Thank you.
We go now to Mr. Van Bynen and Dr. Pawlowski. You have 4 minutes. So you'll have to manage your time accordingly. Please go ahead, Mr. Van Bynen.
Thank you, Mr. Chair, and I want to thank you and your team, Mr. Minister, for the tireless work and your team at the Global Affairs Canada and what they've done and continue to do in bringing Canadians home during these challenging times. My question is, how has the pandemic affected Canada's diplomatic footprint around the world? These people are the face of Canada around the world, so it would be good to get a sense of how many have returned to Canada, how many have stayed abroad, and what the plans are in the coming months and the years to return back to a steady state, because our consular assistance is vitally important to Canadians abroad.
Well, thank you for that question, and I really want to take a moment, and I think as all parliamentarians, to thank the frontline people. Some of them had to go to extraordinary times to provide assistance to Canadians. Some of them were subject to the same restrictions, as you know, the health and safety and movement restrictions. I can think of some of our colleagues in South America and some parts of Europe, which have gone beyond the call of duty to help Canadians. So now, with the Deputy Minister, we have a plan in place. The health and safety and our duty of care to our employees is key. We are looking at gradually making the rotation that we normally do, making sure that our embassies and our missions are staffed appropriately. And to answer a previous question, Mr. Theriault, when you were seeing some people getting answer from other mission, is that we pull together. In times of crisis like that, we pull resources from wherever they might be to make sure we could serve Canadians. So on one end, our main goal is to resume normal operation as soon as it's safe to do. And at the same time, looking at the rotation that we normally do with our consular people. And it's really on a case by case, and I would say even region by region. But I can assure you that we're looking at that because I know that Canadians rely on us, and we are doing our utmost to provide consular assistance in many different ways, because we know there are Canadians which are still stranded abroad, and we are doing everything we can to provide them help with medication, mental health support. We want to be there for them. We've been there for them since day one, and we'll continue to be there for them.
Thank you.
Thank you, sir.
Dr. Pulaski, you have 1 minute and 40 seconds.
Yeah, I'll try to be quick. Mr. Minister, we've had some really great witnesses today that have really shown that we can learn a lot from other countries in terms of management of the pandemic. And that we're stronger as a country in dealing with this if we work together with other nations. Furthermore, we know as long as this pandemic burns anywhere in the world, there's going to be sparks flying off, and we're going to get a recurrence of cases here. So global cooperation in dealing with the pandemic is, I think, really fundamental in us all, everywhere in the world, managing the pandemic. And yet we've also heard from a witness today that the core funding of WHO is less than the funding of a large hospital or some large hospitals in the United States. So would you be willing to consider Canada increasing its core funding to WHO and encouraging other countries to also increase their core funding of WHO in the future? Thanks.
First, let me say thank you for the amazing work that you've been doing. I learned of you as a colleague recently, but you've been doing amazing work in many places in the world, and I want to thank you for that. You really made a difference, not only now, but previously in your life as a doctor. Certainly, I think this is part of the review. You know, when Mr. Genius was asking me, we are at the front and center when it comes to the review of the alert system, of the mission, of the financing and funding of these institutions. If we want them to prevent the next crisis, assuming the next crisis would be a health crisis, we need to make sure that we are present, we are engaged, and we will continue to be as part of this review. And funding of these organizations is clearly front and center in our mind to make sure that we can ensure the health and safety of Canadians, but also the rest of the planet. And that's going to be part of the review. So I would not rule out anything at this particular time. We want to make a difference.
Thank you, Dr. Pulaski. We go now to Monsieur Désolé. Monsieur Désolé, 2 minutes, and I'm going to have to be very, very strict. Thank you. Go ahead.
Thank you, Mr. Chair. Minister, I'd like to have a clear answer, yes or no, or maybe, to my question, please. Are you open, or are you not open to provide damage and compensation to people whose travel insurance has been expired and who have had additional and heavy medical expenses? So is it yes, no, or perhaps? Answer. Well, the relationship with an insurance company is a private relationship. Minister, that wasn't my question. I do understand your question. No, people who are not being repatriated to the country, they will not receive insurance premium. Are you in a position to help them be compensated? Well, if you know specific cases that are still lingering, well, if people still need our help, please tell us who these people are, and we'll be doing our best to bring them back. So you think there's very few people that should be repatriated to Canada, brought back to Canada? Bien. Well, the repatriation operation is almost finished, and some countries do continue. We will continue to do so as long as necessary to bring these people, this balance of people, back to Canada. So it would be advisable for this to be a clear answer for all of our colleagues who might be able to call you. Of course, we receive 600 messages a day, and so I'm strongly encouraging you to do so, and them too. How do you explain the fact that these volunteers, emergency coordinators, who've been spread on those various territories, and they haven't been used? Now, a quick intervention as soon as the crisis erupted would have enabled those people to come back to Canada before the skies were closed, the airspaces were closed. How do you explain that there hasn't been such a quick deployment? Very easy, Mr. Thériault. We had a flight which had been authorized, and the airline authorities, took a different decision at the last minute. So our plan was ready, but as I told you, these plans do change very often given the restrictions, and this is how we should have been working with them in order to bring them back. Thank you.
Mr. Davies, 2 minutes, and again, I'm going to have to be fairly strict. Thank you.
Monsieur le ministre, le 29 mai, le président Trump a annoncé que les États-Unis vont couper tous les liens qu'ils ont avec l'OMS. Quelle est la position du Canada quant à cette décision et en avez-vous parlé avec vos homologues américains?
And I apologize, I could not fully appreciate your question, Mr. Davis. I was trying to change the interpretation as you were speaking.
Hi, I'll try it without my video. The question was on May 29th, Donald Trump announced that the United States will sever all ties with the World Health Organization. What is Canada's position on this announcement, and have you communicated it to your U.S. counterpart?
We believe in the World Health Organization. We believe that they're doing important work. We believe that we should not undermine an institution which is providing essential data and support to many parts of the world. I've heard it from colleagues in Africa, in the Middle East, in the Caribbean, in the Pacific Islands. We will continue to work with the WHO. And like I said as well, is that there will be a time where we need to ask hard questions, but this is not the time. Now we need to support the organization that is helping millions of people around the world during this pandemic.
Turning to the UN Security Council seat, Canada received fewer votes in our bid this time than the Harper government did when its bid was rejected in 2010. Does this pattern of rejection say anything to you about Canada's foreign policy, and if so, what?
Well, there's obviously lessons learned, Mr. Davies, but I don't think it's a rejection of the fundamental principle that we've put forward. If you think about gender equality, climate change, economic security, multilateralism, I'm a firm believer that the values and principles, human rights that we've been defending are worth standing up for our values and our principles, and we'll continue at the G7, at the G20, at La Francophonie Commonwealth. I think it is right for Canada to stand for our values and our principles, which include human rights. And I can tell you that the alliance we've formed, the new alliance, the fact that we've renewed with countries we have never engaged in quite some time, this is value that is going to be, we're going to have dividend for years to come. So I am encouraged by what I've heard from foreign ministers around the world, and we'll continue to engage with the world, defending what we believe is right to improve the life of people on this planet.
Thank you, Mr. Davies. That brings our panel to a close, our questioning to a close. Thank you all. And we are actually over time, but the translators have graciously given us a few extra minutes. So thank you, Minister, and
thank
your
you,
team
sir,
for being here. We certainly appreciate the opportunity to speak with you, and your willingness to stay longer. Appreciate that, and thank you to the minister or to the members as well. And certainly thank you to the translators who have worked once again very conscientiously and through some difficulties. And And thank you for staying late for us. And so we do have a small item of committee business. We have an interim budget has been distributed to all the members. If everyone is familiar with that and is willing to vote on adopting that at this point, if we could do that shortly. Is it the will of the committee to adopt this budget?
Mr. Chair, so moved.
Thank you, Mr. Davies. Seeing no further discussion, we'll go to a vote. Madam Clerk, if you would conduct a vote, please.
Thank you, Mr. Chair. Mr. Fisher. Could you please unmute and say yes?
Mr. Fisher, can you respond? Yeah, there you go.
Thank you very much.
Chair, I guess you would like me to leave. I assume that's committee business. I don't want to. You
yes,
want me to leave? I just want. Okay. You tell me. I'm here, but I know it's committee business.
We don't want you to leave, but you're certainly welcome to do so. It is committee business, and we'll be done, momentarily. Thank you.
Okay. Thank you, everyone. Thank you.
Thank you. Ms. Jacek.
Yes.
Mr. Pulowski.
Yes.
Ms. Sidhu.
Yes.
Mr. Van Bynen.
Yes.
Ms. Jansen.
Yes.
Mr. Genuis.
Yes.
Mr. Kitchen.
Yes.
Mr. Weber.
Yes.
Monsieur Thériault.
Oui.
Mr. Thériault, yes.
Yes.
Thank you. That's 11 yeas, Chair.
I think it carries. So once again, thank you all to all the members, and with that, we are adjourned. Thank you very much.